Hello, my dear friends. A very warm welcome to all of you in this 100th question of PSM. And I have compiled all this question and made some new question with a lot of effort. With this mind, with this thought in my mind is that at least in your exam, at least 25 questions should be from the topics which I am discussing, and at least 10 questions should be directly from the 100 question which I am discussing. And let's start with the first one. In the first one, this is a question being already asked that if a female is coming with your Suraksha clinic with complaint of vaginal discharge, and on examination you found that there is cervical erosion, so in which category you will place this woman? So as per vaginal discharge, she should be in green category, but she also have cervical erosion, and PAAR textbook has written that cervical erosion is indicative of cervicitis. And we all know in gray category, along with cervicitis, there is urethral discharge and also anorectal discharge. So the answer to this question will be gray. And anyway, if there is even cervical discharge, it will come out through vagina only. So the female will complain about vaginal discharge only. So the first category is gray, second is green for vaginal discharge. I hope you all know. After gray and green, the third, fourth and fifth can be remembered by the mnemonic WBR, just like WBC. So it is white, blue and red. This white and blue is for bacterial genital ulcer. In white, we give penicillin, but many people are allergic to penicillin. So in that case, we give doxycycline treatment here. This red is also for genital ulcer, but herpetic genital ulcer. So here we treat with acyclovir. But most commonly treatment which is being given is under category 6, yellow. And they ask this question again and again that female come with lower backache or female come with lower inguinal pain. Where will you place her? So because yellow correspond to pelvic inflammatory disease, which can go and reside in pouch of Douglas. And if the infection is in pouch of Douglas, there will be low backache and lower inguinal pain. So that's why yellow will have this type of presentation also, lower backache, lower inguinal pain. The last 7 is of black, which is for inguinal bubbo. And now what does bubbo means? Bubbo ka kya matlab hai? Bubbo means lymph node swelling. And this is mostly by Chlamytobacter that this inguinal bubbo occur. So do remember these 7 category in derma, gynae, PSM, everywhere they ask it. Now let's do a question on sampling type. If they give you this image that there is a country and from which they have taken some state, from state they have taken district, from district they have taken village, then household, and then on one house they are doing a study. So which type of sampling will it be? This type of sampling will be multi-stage sampling. Multi-stage. Multi-stage is also known as multiple cluster sampling, because in multi-stage we take cluster again and again. Let's say you want to know that how many class 11th, 12th students are smoking marijuana in Delhi. So you cannot ask the question from all the students. So what you can do is you can take a map of Delhi, then from that 3 area you can choose, from those area you can choose some colony, then some schools in colony you can choose some school, and in those school you can do the study on some student, and you will say this is the data for whole Delhi. So this type of sampling in which we choose sample again and again, cluster again and again, is multiple cluster or multi-stage sampling. Now a lot of questions come on these other 3 type of sampling also. First is systematic random sampling. If suppose I have to choose 10 students out of the class for a party, and I am choosing every 7th student, or for an interview I am choosing every 1st and 4th house. So this type of sampling where I am choosing nth number, I am following a system, and how this 1st and 4th came, it came randomly. So that will be systematic random sampling, 1st, 4th, nth. Now, what is stratified random sampling? This is done for heterogeneous population. Let's say I want to choose 10 people for a party, but out of that 10, I want 5 should be boy, 5 should be girl, because I am happily married, settled type of person, but I want that there should be more love among you people. So I'm choosing 5 boy, 5 girl for the party so that they can have good time together. So if I'm dividing into boys and girls, you are heterogeneous, different from each other when it comes to sex. And then I am, by dividing you, and I am selecting equal number from both the boy and girl, that is stratified random. So the question on this has came that people dietary habit differ based on which religion they belong to. So based on religion, if you are selecting people, based on color, if you are selecting people, based on sex, you are dividing and then choosing equal number. All these will come under stratified random sampling. Okay, this cluster random sampling is used for WHO immunization study. In cluster random sampling, suppose I want to know that who have better vaccination, Bihar or Uganda. So every time what I have to choose is, I have to choose 7 children from 30 villages in Bihar and 7 children from 30 villages in Uganda. And Uganda is a real country name, na? Don't say it to me, Uganda, na? So if I will choose 200 people and each 7 children are from the same village, same origin. So this type of sampling is cluster sampling. And always in cluster sampling, our sample size is more than simple random sampling. If I am doing this immunization study by simple random, I can do it on 100 children because simple random will have more variation. But when I am choosing people from same village, I need to choose more people. So the sample size of cluster random is more than sample size of normal sample. And the last 5th type of sampling is just simple random sampling. In simple random sampling, if I have to choose 10 people, I will use a lottery method and I will choose any 10 out of the 100. So simple random sampling is best for homogeneous population. When everyone is similar, same, according to the question, then we do simple random. But if people are different from each other, then we do stratified random sampling. Okay, so do remember this sampling and their questions. Now, can you identify this statistical plot given here? In this statistical plot, you can see they are comparing 2 interventions. Let's say your not so good relative or neighbor came to your home and asked that doctor has asked me to do either angioplasty or stent, which one is better? And suppose you don't know the answer. So what will you do? You will say to your relative, by looking at your face, I feel like urinating, let me go there. You will go to the washroom, take out your phone and type on it Kaplan-Meier survival plot between bypass and stent. So this type of graph can come out. And suppose this lower one is suggestive of, let's say, this lower part is suggestive of bypass and this upper one is suggestive of stent. So upper one, you can see that at time of around 28 months, let's say anytime, let's say 15 months, the number of people who are surviving are less with bypass and more with stent. So the graph which is on the right hand side, this has better survival. Okay, so this type of plot is Kaplan-Meier survival plot, being asked in recent INICT also. The plot which is on the right hand side has better survival. And we cannot be sure that at 18 months only 50 people will survive. It also depends whether they are doing exercise or not, whether they are taking care of their diet or not. So always the answer come in a range. It always come in a range. It can be 30 to 50%. And this range in which the answer is coming, this range is known as confidence band. And there are 2 types of confidence band which we usually use. One is equal precision band and one is Hall and Wellner band. So this 2 has also been asked, which of the following is a confidence band of Kaplan-Meier plot in INICT they have asked. So answer will be Hall and Wellner or equal precision or confidence band. What is confidence band? That range within which survival time come. Because survival time differ from person to person. So this is Kaplan-Meier plot. And I hope you all know when we talk about stem and leaf plot look like this. Let's say I am writing your BP and it is coming 124, 126, 128, 134, 136. So last number will become leaf and remaining number will become stem, and it will be like 12, 12, 12 and 13. Two stem are there on which we will arrange the leaf. So 124, last number become leaf, it will go here. 126, 128, 134, 136. This type of plot, if came in exam, it will be stem and leaf plot. And a stem and leaf plot give us exact distribution. How exactly your BP vary, that is being told by it. Then one more plot is box and whisker plot, which look like this. Box and whisker means tail, poonch. So the box ranges from 25 to 75%, and then there is the whisker. And any value which lie outside this is known as outlier. Like, what is outlier? They are extreme value. Like every 2-3 years, they do a survey in UK that how many sexual partner you had in your lifetime. And usually the answer comes is 2 to 7. But in the same UK population, some hunter can give you result, I have 699 sexual partner, 734 sexual partner. So if you include those hunter data in normal population, the mean of normal population will also increase a lot. So we should we include those hunter data in normal population data? Of course not. We should remove them as outlier. So outlier are extreme value, and this is box and whisker plot, which has two purpose. One purpose is to detect outlier. Second purpose is a Q test for which we draw this box and whisker plot. So this is box and whisker, this is a stem and leaf, and this type of plot is Kaplan-Meier plot, which is going downward. Okay. We will see forest plot in a question also. Now, which is this diagram? Which diagram is this? They are writing BP here, age here. And they are saying, let's say at 10 years, they started measuring BP. So you can see in this image that the child who had lower BP at 10 also has lower BP at 50 year. And the child who has higher BP at 10 also have higher BP at 50 year. So what is this phenomena? This phenomena is known as tracking phenomena. It's look like blood pressure पीछा कर रहा है. Blood pressure is tracking the person. So this question came in NEET also, that in a group they took BP and they found that BP of people, if BP of people are high at beginning, it was also high at the end of study. So it was also high after 10-20 years. So which type of phenomena is this? So if the BP is high in the beginning, there is a higher chance that BP will remain high even at old age. This is known as tracking phenomena. Okay. Now, what is this receiver operating curve? They call it ROC curve. Receiver operating curve is used to find cutoff for a test. Cutoff for test is detected by ROC. For example, the fasting blood sugar cutoff is 126. But how do we got that cutoff? From ROC curve. And ROC curve will look something like this. This 45-degree angle will be a useless cutoff. Then this. The curve with highest slope, this will be the ideal cutoff. And they draw the line between true positive rate and false positive rate. So if this type of image came, ROC curve. If step ladder type of image came, this is Kaplan-Meier plot, Kaplan-Meier survival plot. Okay. And if they gave the image of this type of curve in which BP is high at early, also high remain high at old age, that is tracking phenomena. And if they give you this image of circles and then within it multiple circle are there, this is rule of half. And in rule of half, they have already asked in last MCI exam that what is the innermost circle represent. So the innermost circle in rule of half represent patient who are on adequate treatment. And this rule of half simply say that out of any country adult population, around 50% have non-communicable disease, out of which only 50% know that they are suffering from diabetes, sugar, out of which who know only 50% take treatment, and out of those who took treatment, only 50% patient are adequately treated. they have proper control over their BP and sugar. So that is the innermost circle, do remember it. Now let's come to, after reading about all this graph and image based question, let's come to this second section. 500 women aged 40 to 54 who presented for routine checkup are asked about their meat consumption. 20% of the women turn out to be vegetarian and 80% are non-vegetarian. Now during the in-swing 5 year, 5 vegetarian and 43 non-vegetarian develop colorectal cancer. Which of the following best describe the study design? Option A, cross-sectional, B, randomized control trial, C was prospective cohort, and I recently changed the color of the slide, so the this alignment changed a bit, and case control. So which type of study is it? Cross-sectional, RCT, prospective cohort, or case control? Can you guess? Give me the answer. Chota doctor is replying it as prospective cohort. See, one hint given here is that they are measuring it in swing 5 year. In swing means future 5 year. So what they have done is they took the data, and based on the data, they divided them into non-vegetarian and vegetarian. And then they followed them for 5 years. And after following them for 5 years, they find out that cancer is more in non-veg and cancer is less in vegetarian. So because follow-up is done and we are going in future here, that's why it is prospective cohort. Okay. And this question of meat consumption is being asked only to classify them. Okay. It is not being used to took the past written data. It is only used to classify them. So based on this exposure, vegetarian or non-vegetarian, non-vegetarian are the people who are exposed, vegetarian are the people who are not exposed. So whenever we start with exposed, non-exposed, that is a cohort study, like in this case. Now, in the same question, let's say I change the question and I say that a group of mother, a group of, let's say 10,000 mother asked about smoking and drinking habits through a questionnaire. And we gave them a detailed questionnaire and asked कि क्या तुम सुट्टा पीते हो, क्या तुम दारू पीते हो, है ना? We collected this whole smoking, diet, drinking habit through questionnaire. Then they are followed for next 6 months till delivery. Okay. And data of the 6 month along with past written data of questionnaire, both are used. Past written data of questionnaire is also used, is used to found that mother with a smoking history have more chance of low birth weight baby. Okay, have more 1.2 more risk, more chance or more risk of low birth weight baby. So which type of study is done here in this question? They can ask this type of question, big question. It is already a PYQ being asked. So here in this type of question, you can see that they are using 6 month data and they are also using past written data. So they are going in future also and past also. When you go in future and past both, this is known as mixed cohort because you are going in future as well as in past. So this is mixed cohort. Other name of mixed cohort is ambispective cohort. Because ambispective ka matlab means both side. And the third name can be nested case control. Why they call it nested case control? Because the main hard work is doing 6-month follow-up. Past data can be collected by click of computer, or past data is already collected by 1-day questionnaire only. So main work is cohort, in which case control is inserted, nested. Cohort में case control ने घोंसला बना लिया है ना? In the cohort, case control is inserted. That's why they call it nested case control. All these three, remember, when they give it, there will be two things: future follow-up plus past written record. If both are there, then we call it mixed, ambidextrous, or nested. But if there is only past written record, no future follow-up, only past written record, then we call it retrospective cohort or historical cohort. Retrospective cohort is different from case control, because in case control we took personal history. It start with disease, non-disease. But here we are taking past written record only and no personal history is taken. So the other name of retrospective cohort is historical cohort. And if you add these two together, the mnemonic can be RH. RH for this and MAN for this. And we all know erythroblastosis fetalis occur if MAN is RH positive. So RH positive MAN can help you to remember these two things separately. RH will have only past written record, MAN will have past written record plus future follow-up. So let me give you a practical example for it. Suppose, let's say, from the group some student studied very hard and they selected radiology branch. After taking radiology, you are giving big party, and your neighbor came, his name is suppose Majnu Bhai, he came and said ki, hey, why are you giving this big party? Don't you know that in radiology department staff, based on past written record of 10-year work, it is found that radiology staff has 1.2 times more risk of testicular cancer as compared to other staff. So your testicles are in danger. Why are you giving party? So this neighbor, what he's saying, based on past 10 years, testicular cancer is more in radiology staff. So whenever there is only past written record, which type of study is done? Retrospective cohort or historical cohort. Now suppose you took radiology and you started doing a cohort for the next 3 years, and you did follow up for 3 years and also use past 10-year data. So if you doing follow up and past 10-year data both, then that will be mixed cohort, ambidextrous, or nested case control. If both part is there, then we call it MAN. If only past written record, then we call it RH, retrospective historical. And so these are a new type of question being asked already in INICT and NEET, and I'm expecting it in this July FMGE exam. Now again, there is one PYQ which looks big and which has already came, that in a village ALL case are coming more, and villager think that the chemical factory near to their village is releasing pollution which is causing this more case of ALL. So you thought, let's do a case control study on this. So if you're doing a case control, who will be the control group? I hope this part is clear to you, that when we do case control, control are always those which don't have the disease. They don't have the outcome. And case are those which have the disease. So case will be the people with ALL. Non-disease means there will be no ALL in the control group. Now you will ask the past history, that from where you have drink water in the past. So in the ALL group, let's say 80% children said that I am drinking village water. And in the control group, which has no ALL, let's say 30% children said, out of 100, and both groups, suppose 100 are there, 30% children said that I drink village water, and 70% said that I am drinking other water, not village water, let's say water of RO or city water. And here 20% are saying other water. So this is based on the past history. And anyway, in case control, we all know that we took the past history. So this type of study is being done by you, suppose. Now the question they are asking is that out of these two, which will be the, out of these option A, B, C, D, which one will be the control group they are asking. Okay. So which will be the control group A, B, C, D? Let's see the option and try to understand. First option, children exposed to the chemical waste who do not suffer from ALL. So one thing is sure, that control are those who do not suffer from ALL. Do not suffer, do not suffer. These are correct. But in last option, you can say they have written who suffer from ALL. So if they already have ALL, it means they cannot be the control. And the option D is definitely wrong. Because if you have ALL, you are the case, not the control. Now, out of A, B, C, option A is writing all children are drinking from village water. Children exposed means 100% drinking village water. And children not exposed is written in option B, in which it means 0% drink village water. And in option C, they have taken children from nearby hospital and their OPD. So when you took children from OPD, then it can be the case that 30% are drinking village water and 70% are drinking other water. Okay, now? So in the beginning, we cannot know whether 100% are drinking village water or 0% drinking village water. We cannot take such group in the beginning. Because in the beginning, if you already took 100% drink village water, what will you ask in past history? And if you already know that 0% drink village water, then also what will you ask in the past history? So you have to take a group in which some are drinking from village water and some are drinking from outside water. Only then you can ascertain whether water is causing the problem or not. So we cannot take exposed or non-exposed at the beginning. Exposure we ask by taking history. In the beginning, we cannot know whether exposure is there or not. So what will be the correct answer? The correct answer will be option 3, that children from hospital OPD who do not suffer from ALL, they will be taken. Because if you took OPD patient, then out of them, some are drinking village water, let's say 30%, and some are not drinking it, let's say 70%. And then you can confirm it through this data that ALL is more in that group which is drinking village water. That means village water polluted by the chemical of the factory is causing the cancer. So in the beginning, we cannot have exposed, non-exposed. In the beginning, we have to take the children who are mixed, coming from OPD. Let me explain it with another example to you, and then I will come to this next question. But first, let me explain it with one more example. This question has already been came in the MCI exam. The question was that online food ordering is said to be associated with obesity. So in a case control study, what will be the two group? Or in a cohort study, what will be the two group? And suppose option A is online ordering present and online ordering absent. And option B is obesity present and obesity absent. So what will be the two group in a cohort study? For a cohort study, option A will be the two group or option B will be the two group. Cohort, do remember this point, that cohort, when we start, it has two group which are exposed, non-exposed, karan present, karan absent, risk factor present, risk factor absent. And in this story, what is the risk factor we are talking about? The risk factor is online food ordering. So if it is cohort, then the answer will be option A, because online food ordering is the reason. Now, in a case control, what are the two group? In a case control, the two group are disease present, disease absent, or parinam present, absent, outcome present, absent. And what is the outcome here? Outcome is obesity. So obesity present absent, this will be the two group. Obesity present will be the case, obesity absent will be the control. And if you took this two group, obesity and no obesity, and you ask them the history, that how many of you are ordering food online, then out of obesity group, there is a chance that 90% will say that I order food online. And in no obesity group, let's say 40% said that I order food online. So from this data, we can conclude that people with obesity are ordering food online more, so they have obesity, and people without obesity are not ordering food online or ordering food online less. That's why they are free from obesity or they don't have obesity. So in the beginning, we have 90 and 40% in the past history when we took. I cannot say that in this second group with no obesity, 0% order online, or I cannot say that 100% order online. If I already know 0% or 100%, what will I ask in the history? There is nothing to ask if we already know the answer that 100% order or 0% order. So I cannot take all people who are ordering online, all exposed, or I cannot take all non-exposed. I have to take a mixed population out of which 40% are ordering, 60% are not ordering. Okay, so always remember, in a case control study, first thing is we start with disease present absent or outcome present absent. Second thing is that we cannot take all exposed or all non-exposed. We have to take that group which has mixed population, like option C. And this is the way to differentiate between cohort and case control. Okay, a lot of questions come on their differences, and I hope you will be able to tell it clearly. When it comes to cross-sectional and ecological study, the cross-sectional and ecological, they are done when there is only one population or one group. But the difference between them is, in cross-sectional, we collect data or ask question from every participant. But in ecological, we collect data or ask question from no participant. We just collect population data and we correlate it with hospital data. That is why ecological study is known as, other name of ecological study is correlational study. Because in ecological study, we don't ask question from person. We directly ask question from authority and collect the data for the whole population. So no question from people will be ecological, and question from every participant will be cross-sectional. Okay, so do remember this differential method to decide if there is one group or population, then it can be cross-sectional ecological. In cross-sectional, question from everyone, in ecological, question from no one. And if it is two group, then it can be cohort usually or case control. Cohort start with risk factor present absent. Case control start with disease present absent. Okay, so this is the way to decide which study is done there. And further on in this 100 question, I will give you some more example of such study, and you will have to decide which study is done there. Okay, so I hope this is clear. If not clear to anyone, let me know. Next question is, when they are asking to identify the image, this image, and there are this circle, and on this circle there are various factors, but in every circle definitely there is this factor B is always there. One factor is always present, and if one factor is always present in every circle, the light of this slide is not making it clear, but what they are just saying is that in every circle this B factor B is always there, and there can be other factor also contributing, but B is always there. So this type of model is sufficient component cause model. Suppose I am talking about diabetes, and I am talking about diabetes in my friends, in my father and other relative. And in my friend, smoking is there, alcohol is there, and stress is there, which is causing them diabetes. In my father, there was stress, but there was no smoking, no alcohol, but there was betel nut chewing. So smoking is not there, but tobacco was there. Then there was less exercise in my father, more food was there, fatty food was there. So there can be various reasons for diabetes, but again and again, if I found stress is the reason, it means stress is a sufficient component. If stress is there, single-handedly it can cause diabetes, because stress is coming again and again in all the component. Stress is coming in all the people. Stress is definitely one of the reason which is causing diabetes. So this type of image they will give with circle and one factor common in all. So if one factor common in all, that is example of sufficient component cause model. Okay, do identify it. It's a new question which they are asking. Now let's do this numerical question. Sorry for the cough. They are asking, they have given some data and they are asking, what is the average number of metastatic lung lesion for patient treated with new drug? They are asking to find out the average. So in this question, you can see 50 people have zero lesion. 50 people zero lesion. So 50, we will do 50 into zero lesion, plus 30 people, you can see 30 people have one lung lesion. So 30 into 1, plus 10 people have 2 lesions. So 10 into 2, plus 10 people have 3 lesions, also 10 into 3. So this is the total number of cancer lesion. And it is divided by total people, because when we took average, we add all the number and we divide it by sample size. So what is the sample size here? 50 people with 0, plus 30 people with 1 lesion, plus 10 people with 2 lesion, plus 10 people with 2 lesion. So how much will come out in the denominator? Denominator is 50 plus 30, 80, and 10 and 10, 100. So 100 is there. And to get the answer in percentage, we can multiply by 100. And above 100, 50 into 0 is 0, 1 into 30 is 30, 10 into 22 is 20, and here also 20. So 30 plus 20 plus 20, it will come 80. 80 by 100 is coming the average. And if you write 80 by 100, it will come 0.8. So 0.8 means it is between 0 and 1. Okay. So even without calculation, you can do such question. If major population have 0 lesion, it means average will come between 0 and 1. Because I hope you know the concept, mean get deviated towards bigger number, or mean get deviated towards most commonly repeated numbers is mode, but mean get deviated towards the skewed part, the stretch part. So if more people, 50 people are between 0 to 1, then average will also come between 0 to 1. And even without calculation, you can answer such question. Now, next question is that, that's a question from entomology. They have given you image of an insect, and they are asking that this insect transmit which of the following disease. This is very common type. Head is covered in the back covering, which is known as scutellum. So you cannot see the head in soft tick. Plus, who will have long leg? And a long leg will be of hard tick, because it's not covered, so it will come out. So this is hard tick, and exactly like hard tick, there is exodid tick or deer tick. They also look like hard tick. And this exodid tick or deer tick, they transmit 2 disease. One is Lyme disease, other is babesiosis. In Lyme disease, there is a lesion which is bull's eye lesion, and we also call it target lesion. Saand ki aankh, bull's eye lesion, target lesion. We also call it erythema chronicum migrans, and it will be red color going outside. So that is erythema chronicum migrans, target lesion occur in Lyme disease. And in babesiosis, there will be a blue color, this type of thing on peripheral smear. We call it Maltese cross. So both of this question can also come. They can give you in NEET 2018 already they have given you image of Maltese cross and they ask who transmit this disease. They did not ask the disease. The disease will be babesiosis, but it is transmitted by ixoid tick or deer tick. So do remember ixoid tick, deer tick. Now let's talk about what are the disease transmitted by hard tick. Hard tick transmit first of all Cassandure forest disease, which is also known as monkey disease. Then it also transmit Rocky Mountain spotted fever. It also transmit Indian tick typhus. Then it transmit tick fever, tick paralysis. So how will you remember it? See, the method to remember is all the disease with tick, T, is by hard tick. All the disease with T is with hard tick, except one disease which is trench fever. And we can revise it now, all the entomology disease together. Trench fever we will read is transmitted by louse, head lice, and we will discuss it. But other than trench fever, all T by hard tick. And Cassandure forest disease, Rocky Mountain spotted fever, two things you have to remember. Anyway, the causative organism for Rocky Mountain spotted fever is Rickettsia rickettsii. And so during my preparation time, I used to think that Rocky is some adventurous guy who is climbing the mountain again and again. Rickettsia rickettsii. And anyway, Rocky Mountain, these all are hard thing. So it is transmitted by hard tick. And Indian tick are Indian tick typhus, again Indian are hard and also hard tick. So Rocky Mountain spotted fever caused by Rickettsia rickettsii, KFD, is transmitted by hard tick like all other T disease except trench fever, which is by louse. So now this image can be of both hard tick or ixoid tick, deer tick. And out of the four options, one option is transmitted by hard tick, that is KFD. Remaining these three, plague, which is actually bubonic plague, which occur first. Bubonic means it will occur on the bubo first, lymph node first. And the causative organism of plague also they have asked in NEET exam, that is Yersinia pestis. So plague, they created this question, patient come with inflamed buboes. What is the causative organism? Yersinia pestis. So bubonic plague, then hymenelepsis, endemic typhus is transmitted by, all these three are transmitted by rat flea. And we can remember it to make together by the mnemonic BAME. BAME transmitted by rat flea. What is BAME stand for? B for bubonic plague, H for hymenelepsis, E for endemic typhus. And endemic typhus is also known as murine typhus. So endemic typhus, murine typhus, BAME. So to remember the thing transmitted by rat flea, I used to imagine that suppose this is a rat flea, the image of rat flea, you can see it. And on that rat flea, there is this Chota Bheem sitting. And what is this coming out from Chota Bheem? This is the weapon of Chota Bheem. So why I made this mnemonic? Because Chota Bheem is our local hero now. Only in India we know about it. And Chota Bheem is endemic to India. So rat flea, on which typhus is transmitted by our childhood friend louse, head lice. Remember? So epidemic is by lice, louse, endemic by Chota Bheem, rat flea. So do remember what are diseases by rat flea? Bubonic plague, hymenelepsis, endemic typhus by rat flea. And then when they talk about louse or lice transmit four diseases, which are first of all pediculosis, then there is, as I said, epidemic typhus, then there is relapsing fever, and the fourth is trench fever. Okay, so if you try to remember the disease by louse, you can use the mnemonic PERT, P-E-R-T. All these four are there. PERT will be the mnemonic. And anyway, remember your childhood days. When you used to take out a lice and kill it, it used to produce a sound of PAT. So the mnemonic is also PAT. And they'll ask this question again and again in exam, that there is a man bitten by some insect, and after being bitten, developed rash and fever. So who is the causative organism? In 99% time, if they give a history of man bitten by insect, rash and fever, answer is epidemic typhus, which is transmitted by louse, and the causative organism of epidemic typhus they can ask sometime is Rickettsia prowazhaki. Okay, so do remember this endemic typhus. If they ask, endemic typhus is transmitted by rat flea. And who caused endemic typhus? Endemic typhus is caused by Rickettsia typhi. So these two, endemic, epidemic, used to confuse me a lot during my MBBS days also. So how I remembered them separately is that typhoid is local, endemic to India. So typhi, endemic typhus. And epidemic, big thing, so prowazhaki, power is causing epidemic. So prowazhaki, epidemic typhus, typhi, endemic typhus. Okay. And this two, if you remember, most of the time they ask questions from these two only. And do remember, louse transmit these four diseases: pediculosis, epidemic typhus, relapsing fever, trench fever. You already remember the disease by heart tick. You already remember the disease by rat flea, which was Chota Bheem, hai na? Bubonic plague, hymenolepsis, endemic typhus, murine typhus. Last thing which you can remember is mite. Mite transmit three diseases. One is rickettsial pox, second is scrub typhus, third is scabies. Now, scrub typhus is caused by Sarcopittus scabies. Scrub typhus is caused by Orienta chuchu gambusi. Susu gambusi also you can say. Susu gambusi or chuchu gambusi. And this scrub typhus is transmitted by a special type of mite. We call it trombiculid mite. Again, a very common PYQ. Scabies is by Sarcopittus scabies, and itch mite transmitted. Itch mite, khujli wala mite, and itch mite transmitted. So to remember the disease by mite, we can use one of the two mnemonic. One mnemonic which I made during my MBBS time was PSM sada hua. PSSM, because I used to hate this subject a lot during my MBBS time. P for rickettsial pox, S for scrub typhus, S for scabies, and M for mite. But then you can also remember it by another mnemonic, RSS. And rickettsial pox, scrub typhus, scabies. So it's all up to you whether you can use the mnemonic RSS or PSSM, and you can take any one of them as mite, and they are the one who are RSS and PSSM is being transmitted by mite. Okay, so do remember the disease transmitted by these four insect, and you will be able to do most of the entomology question correct with just this 5 minutes of discussion. If you will remember, you will be able to remember most of the things correctly. Do remember this three mnemonic: PERT for louse, pediculosis, epidemic typhus, relapsing fever, trench; RSS for mite, which you already just read; and BAAR for rat flea, bubonic plague, hymenolepsis, endemic typhus, murine typhus. Okay. Now, sometime in exam they can give you image of this insect. Who is this insect? This is the Imran Hasmi of insect kingdom. We call it the kissing bug. Kissing bug, redwood bug. You know why it is known as kissing bug? Because it is so pervert that it only bite near lip. So we call it kissing bug. Imagine what if it bite near other hole, and then we would have called it something else. The second reason and the way to identify this kissing bug is this pouting. And kissing, for kissing, it's so into kissing that is always pouting. So with the pout, you can identify this redwood bug, kissing bug. And this redwood bug, kissing bug transmit only one disease, chagas. And so you can say it like this, that redwood bug give chagas kiss. And chagas means very good kiss. So this is redwood bug giving chagas kiss. Okay, do remember it. Chalo, now After this entomology revision, they can give you life cycle related question. So can you identify this life cycle? In the life cycle, there is a, first of all, there is an insect. And there is image of an insect. Then they have given some image here with a square like thing. This is, can you see this? Appreciate it. This thing they have given. And then they have a tick also written. Tick. So which cross they are talking about? This is the Maltese cross. And we just have read right now in which disease Maltese cross occur. Maltese cross occur in babesiosis. And who transmit babesiosis? Babesiosis or Lyme disease is transmitted by ixoid tick or deer tick. Okay, so answer is babesiosis. Now, if they give you life cycle of leptospirosis, which they have already given in INICT, there will be rat urine and human both in that cycle. If they give you life cycle of JE, I am sure you will be very easy to identify. There will be Culex mosquito and there will be ardid bird and pig. Now, the question they ask from here is that who is the reservoir of JE? So in case of JE, ardid bird is the reservoir. And who is the maintenance host? Maintenance host is also ardid bird, which is also known as heroin bagula. Heroin. Okay. Why they call it as the maintenance host or reservoir? Because they store the virus when there is non-rainy season and they maintain it in non-rainy season. Then in the rainy season, in the story enter our nuisance mosquito Culex. Culex is so talented that it can bite in the bum of flying bird, है ना, उड़ती चिड़ैया के बम में काट लेता है. And then it bite in the bum of sewer white, bite in the bum of pig. And after biting in the bum of pig, it bite in the bum of Gadhawa human. And human are accidental dead-end host. Accidental dead-end host means if I am suffering from JE and a Culex bite me, then it cannot transmit JE from me to you. Just by biting me, it cannot take the virus and cause JE to you. It need to bite a fresh pig, and then from that fresh pig, it can come and cause JE to human. So human do not transmit infection from one to another just by Culex bite. That's why human are dead-end host. And who is pig here in this story? In this story, what is the role of pig? Can you tell me? Pig is which host? Amplifying host. It amplifies the virus. Okay. So I used to think that pig must be singing this song for JE. कि मैं तेरा amplifier huna, and so this is amplifying host pig. Dead-end host is human. Reservoir or maintenance host ardid bird. Again and again ask question. Now, coming to the next question. A person, this is a very interesting question. Person report 4 hours after having a clean wound without laceration. 4 hours he came back. And his last TT taken is 11 years before. What is the next step of management? What will you do? Will you give tetanus vaccine? Full course. Full course means 5 tetanus. 5 DT or 5 TT is full course. Will you give full course along with tetanus immunoglobulin? Will you give single dose of TT? Let's also make one more option. Option E. Option E is DT plus tetanus immunoglobulin. So what will be the correct answer of this question? Dr. Nigar Ansari and Dr. Mantis, very quickly they replied that we will give single dose of TT. First thing is that full course is only given if the history is already forgotten. If you don't remember the history, then you give the full course. And here the history is there of 11 years. So full course is only when history forgotten. Okay. And if history is forgotten, and there is clean wound in less than 6 hour, patient came non-penetrating. In that case, we will give along with full course, nothing else, only full course of DT5 thing. But if history is forgot, and the person has any other wound, other mean not clean in less than 6 hours, other wound, then in that case, along with full course of TT, we also give tetanus immunoglobulin. Okay. Similarly, if the history is more than 10 years, in case of more than 10 years, in case of clean wound, we give only one DT, only one TT. But in case of other wound, and are not coming within 6 hours, penetrating, lacerating, along with DTTT, we also add tetanus immunoglobulin. So first thing, full course is only given when history forgotten. Second thing, tetanus immunoglobulin is given only in case of other wound. It is never given in clean wound less than 4 hours. And here in this story, they are giving history of 11 years back, but it is a clean wound within 4 hours. So because it is a clean wound within 4 hours, whether it is 11 year or 21 year or anything after 5 years, answer will be single dose TT, because immunoglobulin we only give in case of other wound. And the best thing to remember is that up to 5 years, if any kind of wound came, we only wash, we don't give any DTTT. And if patient came between 5 to 10 years, no matter which type of wound is there, we only give one DT or one TT, in dirty wound also and in clean wound also. So up to 5 year wash, 5 to 10, one DT. This is uniform. Only thing is more than 10 year, in case of clean, we will continue with the same thing which we give in 5 to 10. But in case of other wound, along with that, we will add tetanus immunoglobulin. Okay, and full course is given if forgotten. F for F. Double F, full course when forgotten. Simple. Okay, so I hope you will remember it. When will we give E? This E option will be there if I say that there is a dirty wound, or let's say someone has a road traffic accident, and the time taken when the last DT was taken, it was last DT was more than 10 years. Only then we will add immunoglobulin. So immunoglobulin in case of dirty wound, more than 10 years back taken, one TT, then we add tetanus immunoglobulin. Okay, I hope you will remember this, and I am expecting one question from tetanus for sure. So do remember the guideline, and they have put this guideline, change guideline in the recent edition of PAAR. So you should be able to answer it. Now let's come to this question. They are showing a gametocyte in the peripheral smear. Can you tell me which gametocyte is it? Is it falciparum, vivax, ovale, or both A and B? Both falciparum and vivax. What is this gametocyte? So in the RBC, if you found granules inside RBC, granulated RBC is for Plasmodium vivax. Granulated RBC, Plasmodium vivax. If it is falciparum, then within the RBC there will be banana shaped nucleus, but there will be no granules. Okay, one of the student Pratik Mane is asking that, sir, is rabies guidelines same for pregnancy also? Yes, my dear friend, because we will discuss about it, killed and live vaccine. We have also discussed it in one session, 30 question session I took with Arise also, in which also we have discussed all the vaccine classification. So when it comes to killed vaccine are total 7, hepatitis A, rabies, and then 5 are those which are both live and killed. You can remember by the mnemonic CP, IJO, come to center point, cannot place, and come to CP. And in our time, when a girl or boy used to ask someone to come to CP, it means there is a chance of good time together, date or something. So CPPI, जो C stand for cholera, P for polio, P for plague, I for influenza, and J for Japanese encephalitis. These 5 vaccine, they are killed as well as live. So rabies is a killed vaccine, and killed vaccine can be given to any immunocompromised patient or pregnancy, no problem. The problem is in giving live vaccine. When we give live vaccine, we make it sure that the patient is not pregnant and the patient is not HIV or immunocompromised. Like they can create this picture, clinical picture, a patient of nephrotic syndrome on steroid. Which vaccine not given? So all the immunocompromised patient, live vaccine not given. Now what are the live vaccine? 5 are these simple CPPI, they are live and killed both. Apart from this 5, 6 is BCG, then there is MR, and MMR or MR. Then there is yellow fever vaccine. This yellow fever vaccine, as you all know, can be given in pregnancy also, and yellow fever give lifelong protection. So BMY, BMY 3. Then there is the TB. TB can be used to remember 2. One is typho-oral, which is live, and typho-oral is given on day 135. Other is V for varicella, and varicella have Okka strain. There is a song also, Savila Villa, Savila Villa. It's time to Africa, Waka Waka. That's the strain here for varicella, Okka strain. Okay, so these 7 are killed. Very easily remembered. CPPI, hepatitis A, rabies, and this 11 are live. 5 are CPPI, then BCG, MR, yellow, typho-oral, varicella 9 and 10, and the last 11 is rotavirus. Remember, rotavirus vaccine is not a protein vaccine, is a live vaccine, and rotavirus vaccine is not given after 6 months. And we don't give it after 6 months. The first dose is given till 15 week, second dose is given till 24 week. So these 11 are live vaccine. Do remember them. They will not be given to any nephrotic syndrome child on steroid or immunocompromised or pregnant female, except yellow fever, which can be given to pregnant female, of course. Okay, and do remember this thing. Gametocyte, if granulated, it is Bivax. Now, in recent NEET INI-CT, they have asked that which will help us to identify species. This Plasmodium falciparum and Vivax, these are identified by thin smear, thin blood smear. We took a drop of blood and we take the upper slide very close to it. So in the thin blood smear, we can identify the species, because then we can see the characteristic of gametocyte and we can say is it Vivax or falciparum. So species is by thin blood smear, and thick blood smear is used to identify presence of Plasmodium, because thick will have more blood. So it will not give us the detail of gametocyte, it will not identify species, but it can help us to know whether Plasmodium is present or absent. Okay, so these are thin and thick smear. And of course, I hope you all know that MPW, multi-purpose worker, which is same as health worker male, they prepare this slide by active surveillance. Active surveillance means searching for hidden cases. We will read about it. Active surveillance is for hidden case. So MPW go door to door and search for hidden case of malaria and make this 2 slide. If anyone has fever, they will take the blood sample and they will make this 2 slide. So this question has been asked also. Do remember it? Coming on to the next question. Can you identify this mosquito? I am expecting your answer very soon. Can you identify this? Bharat Saini is saying that sir, एक बार national immunization schedule बता दीजिए. Okay, why not? I can definitely, we can discuss and remember national immunization schedule also after identifying this mosquito. Which mosquito is this? This is the nuisance mosquito. Nuisance mosquito is the other name of Culex, and Culex transmit J. filariasis in India and West Nile fever. So first thing is, why they call it nuisance mosquito? Because Culex is the one which breed in dirty water. ये अपना देसी लौंडा है, and it's when it feel like breeding, it doesn't see whether it is dirty water or any water, and because it breed in dirty water, so we call it nuisance kachada mosquito. And see, JE and filariasis is transmitted by it, but the second thing is West Nile fever. So Nile can be remembered as Nali, and Nali means sewage water, dirty water. So who breed in sewage, dirty water? Culex. So who transmit West Nile fever? Culex. Okay. And there is one more fever, Rift Valley fever, which is transmitted by Aedes. So to differentiate Nile fever by Culex, Rift Valley fever by Aedes. This can help you there. Now, how to identify Culex? Three way. First thing, Culex has hump, not bump, hump. You can see this hump. Second thing, Culex have golden brown bum. So there is hump, there is golden brown bum, and second thing is there will be hair on the back, hairy back will be there, and it's like Anil Kapoor of our insect kingdom. And so remember these three things: hairy back, hump, and golden brown bum. These are the things in Culex. Three things, three disease: Culex, JE, filariasis, West Nile fever. So this is definitely Culex. Now they ask this, and Culex is known as nuisance mosquito. The correct answer become nuisance. See, Mansonii is a mosquito whose mouth has multiple apertures, multiple things, and very long leg. Mansonii breed in root of aquatic plant only. And Mansonii transmit only one disease, that is Brugian filariasis. So Brugian filariasis by Mansonii. Now, sandfly, of course, you will be able to appreciate it very well. It will have hair-like structure on the body and all. So when we see it from distance, those hair look like sand on the body. That's why we call it sandfly. Scientific name is phlebotomus. And sandfly transmit oriental sore, Oraya fever, and leishmaniasis. These are two types of leishmaniasis: topical leishmaniasis, which occur on skin, and visceral leishmaniasis, which is known as Kala Azar. Kala Azar. So, in the visceral leishmaniasis, there will be hepatosplenomegaly. Sometimes they give this clinical picture that a patient have hepatosplenomegaly after bitten by mosquito, and he don't have malaria. So answer become Kala Azar. So how to remember phlebotomus disease? You can remember it by saying it with me. Just say it with me and you will remember. Topical Kala Azar. Kala Azar. Topical Kala Azar. And these are the diseases by phlebotomus. Kala Azar. That's the mnemonic to remember it. Now, a lot of time they ask this question, that which mosquito have a spotted wing? Can you answer this question? Which mosquito have a spotted wing? And as soon as the question comes, student answer Aedes. But Aedes, remember my friend, have black and white stripes on leg and body, but no spot on the wing. Spotted wing is sophisticated mosquito. Sophisticated mosquito is the other name of Anopheles. Why they call Anopheles as sophisticated? Because Anopheles breed only in clean water. No dirty water, no dirty talking, clean water. Second reason why Anopheles is sophisticated is, whenever it bite, it first lifts its ano, then bite at a 45-degree angle. No touching also. So you can see ano and then phylus. Okay, that's why it is Anopheles. And it has a spotted wing. So do remember, Anopheles spotted wing, of course it transmits malaria only. And Aedes, the remaining 5 diseases are by Aedes. Very simple to remember. Aedes disease. Aedes is the tiger mosquito. Aedes disease can be easily remembered by C and D, chikungunya and dengue, then Y and Z, yellow fever and Zika virus fever, and last we just read Rift Valley fever. So if I am a mother and I developed Zika virus, तो क्या होगा? If I am a pregnant mother, as you can see, and I develop Zika, तो मेरे लॉन्ड की होगी छोटी मुंडी. My child will be born with microcephaly. Plus the second thing in Zika virus that will occur is Guillain-Barré syndrome. So these two things will occur there. Now, very good. Next question, next thing which we can discuss is that let's quickly revise the national immunization schedule in such a way that you don't forget. To remember the national immunization schedule, we just have to keep doing 3-5, 3-5 we will do, and we will remember the national immunization schedule very easily. 3 are the vaccine which is given at birth. What are the birth vaccine? We all know BCG, OPV, but only 0 dose is given here, and Hep B. 3 vaccine. Mother, child, father. 3 people starting birth, 3. Then 5 vaccine is given at 10 week. What are those? 6 week. First 6 weeks child come and 5 vaccine are given. Rotavirus vaccine, pentavalent vaccine, and OPV. OPV, Rota, Penta. 3 vaccine. And this same 3 vaccine is also given at 10 week and 14 week. So same 3 here, same 3 here. OPV, Rota, Penta, 6, 10, 14. Okay. Then there is FIPV and PCV. And it's fractioned IPV, not fucked IPV. And this FIPV PCV is given at 6. Then it is not given at 10. It is directly given at 14. And then it is given at 9 months. So these two, 3 plus 2 total 5 are at 14, 3 are at 10 week, and we will read what are the things in 9 months. But before that, to remember the national immunization schedule, first remember this half. If you divide it into half and then remember, then it will be better and it will be in your mind forever. So how will you remember it? You already remember the things at birth: BCG, OPV, B, OPV, Rota, Penta, 6, 10, 14. Then FIPV, PCV, 6, 14, 9 months, 6, 14, 9 months. And at 9 months, by sequence order, it should come 3. But these 2 are newly added. So what are the 3 things which we give at 9 months? Vitamin A, we give 1 lakh. Then we give MR and JE. And so easy to remember, the same 3 things are repeated at 16 to 24. Same 3 things. Vitamin A, MR, JE. Only thing, the dose of vitamin A become 2 lakh if the weight of the child is more than 8 kg. Then at 16 to 24 month, we give 2 more things: DPT booster and OPV booster. And this same DPT and OPV booster are repeated at 5 year. So at 5 year, 2 are this DPT, OPV, and last dose of vitamin A, 2 lakh international unit is given. So total 3 thing at end, 3 thing at beginning, and here 16 to 24 again became 5. So everyone is 3, 5, 3, 5, 3, 5. Only 9 months is disturbing the flow. Yahi bhadwa hai. This is disturbing the flow. Rest are 3, 5, 3, 5, 3, 5. Very easy to remember. So after this, also we have to note this 2 things, that at 10 and 16 year, 2 times we give DT. This was the question in last NEET exam. At 10 year, which vaccine is given? DT, not TT anymore. DT we give. Same one more time we give DTs during pregnancy. 2 DT at 4 week gap. Any time during pregnancy we give. Okay. So it's not so difficult to remember if you remember it in half part. And you remember OPV, Rota, Penta, 6, 10, 14. That then vitamin A, JE, MR at 9 months, same thing at 16, 24. And we add 2 things at 16, 24, DPT, OPV, which is given at 5 year. So it is there. 2 DT at 4 week gap, anytime during pregnancy. But if last pregnancy has occurred within 3 years, then and 2 DT is taken in that last pregnancy, then we give only 1 booster dose. If last pregnancy is more than 3 years back, then we give 2 DT. Okay, you understand the point now? Let's say I'm a mother, I came to you and you ask, when was you pregnant last time? I said last year only, Dr. Saab. क्या करूं, मेरा मुंह कसम छोड़ता ही नहीं है. My husband make me pregnant each year. And I had taken 2DT in last pregnancy. So because I was pregnant within 3 years, only one booster is given. But if I was pregnant 4 years back, then you will give me 2DT. Okay. So that's the national immunization schedule. I hope you will remember it and revise it. Okay. If you have any other question, feel free and ask it. And don't hesitate in asking it. Chalo. Next question is, a large study of serum cholesterol level in patient with diabetes mellitus revealed that the parameter is normally distributed. Big line they have written, which is useless. Mean they have given 230. Standard deviation is 10. They are asking 68% value will lie where. So if you can do this question, give the answer. In this question, actually there is no calculation. Very simple basic calculation, plus minus only. And last time they have given 2-3 numericals because they are giving calculator in MCA exam. So again, they can give you calculation based question. And I am expecting this type of question on 68 and 95% confidence interval. I hope you all know 68% confidence interval is mean plus minus 1 standard deviation. 95% confidence interval is mean plus minus 2 standard deviation. And this formula are correct for any sample, because standard deviation is for a sample. So what will be the 68% confidence interval? Give me the answer. My dear friend, Chota Doctor has given answer 220, 240. His name is actual name written there is Chota Doctor. 220, 240. So let's see whether Chota Doctor is right or not. He made me remember Chota Don. So that's there. Anyway, mean is 230. Standard deviation is 10. So plus minus 1 into 10. 230 plus 10, 240, 240 minus 10, 220, answer become 1. And my dear Chota Doctor is right. Okay. Now, same Huma Tabassum, Rajat Srivas and Jayendra is also right. Very good, my dear friend. You all are right. Now let's come to 95% confidence interval. If in the same question you have to find 95, what will be the answer? 230 plus minus 2 into 10. So plus minus 2 into 10 will be 210 to 250. Here it will be 220 to 240. And this 210 to 250 will be for 95%. So this is one numerical very frequently asked. And sometimes they ask 68%, but the student still multiply them with 2. No, 68% is 1 standard deviation. 95 is 2 standard deviation. And if they ask how many value are between mean plus 1 standard deviation, how many value? Is it 0.34? Is it 0.47? Is it 0.68? Is it 0.95? What will be the answer? So this is a standard normal curve. I hope you all know in the standard normal curve, mean is in the center around, and that is 0. Plus 1 is here, minus 1 is here, and between plus 1 minus 1, 68% value lie. So how many value is mean plus 1 standard deviation? What is the answer? How many value is mean plus 1 standard deviation? So, and also remember that in the 3 rules of standard normal curve, the first rule is mean, median, mode, all are in the center and all are equal to 0. But mostly they ask question from the second rule. The second rule says that area under this standard normal curve is equal to 1, and that is equal to standard deviation, that is equal to variance, all are equal to 1. So usually they ask question from this thing. Area, standard deviation, variance, all are 1. This is the second rule. The third rule is within plus minus 1, 68% value, within plus minus 2, standard deviation, 95%, and within plus minus 3, 99% value lie. Now, what is the answer there? Hosla is saying C, but your drug of choice is saying 34A. Mantis is also saying A. Answer is definitely A, because they are not asking mean plus minus 1. If they ask mean plus minus 1, it is 68. But they are only asking half of 68. And half of 68% is 34%. So 34 means 0.34 will be the answer. Very good. Now, let's move to the next question. This is also on the confidence interval, but a tricky one. Let's see whether you can solve this trick or not. They are saying that there are 400 medical students, mean score they have given, mean score is 60. Standard deviation is 10. They are asking that how many students score greater than 80 on this test. है ना, ये दारू की बोतल नहीं है भाई, पानी की बोतल है. ऐसा नहीं है कि इसमें फ्लेवर्ड बोर्ड का है ना. Strong है. Come tell me. This mean is 60, standard deviation is 10. Question is, how many students scored greater than 80? Can we answer it? To answer such question, first of all, we have to find 95% confidence interval, which is mean plus minus 2 standard deviation. So mean is 60 plus minus 2 into 10 if you will do, it will come 40 to 80. So within 40 to 80, 95% people come within 40 to 80. Now my question is, how many people are more than 80? How many people are more than 80? Give me the answer. So this is the curve. 95% are here, 40 to 80. How many are more than 80? Total is 100%. 95% is between it. So how many are outside 40 to 80? 5% are outside 40 to 80. But will that 5% will be on one side? No, those 5% will be 2.5% on this side, 2.5% on this side. And it's quite obvious. 5% will be divided 2.5, 2.5 on both sides. And what is 2.5% of 400? 400, 1% is 4, 2% is 8, and 0.5 is 2. So 2.5% of 400. And that means 2.5% of 400 is 10. How will you find it? 2.5% of 400. So what we can do is, how will you do it? 2.5% of 400. Simple. You will 2.5% to remove the minus sign. You can put 100 there. 2.5 by 100 multiply by 400. So this 20 will cancel. 2.5 into 4, it will come 10. Anyway, 2.5% of 400 is 10. So answer is 10, not 20. Very good. All of you have given 10 as answer. Puneet Sarma, Dr. Flag, Nidhi, Bharat Saini, all of you have identified it correctly. Very good. Smart enough to give the answer. Oh, here in this question, they have given this formula, which has been asked 2 times in INICET exam, that under root sum of mean minus number whole square by n minus 1. This is the formula of which of the following? So this is the formula of standard error. Okay, if you remove the under root sign, then it will become the formula of variance. Variance is sum of mean minus number whole square by n minus 1. This is the formula for variance. This is the formula for standard deviation. Okay. Now, that is why we say that standard deviation is under root of variance. If you put under root, it becomes standard deviation. If you remove under root, it becomes variance. And because they have asked it 2 times in INICET, I'm expecting it to be coming in your exam in this time. Okay, so do remember it. Now, let's move ahead. Very good. Next question is, a drug which reduces mortality but does not cure a disease will lead to which of the following? So this type of question has to be answered with the concept that prevalence is incidence multiplied by duration of disease. Let's say from your batch, Dr. Bharat Sen took MD medicine, and after that he took DM cardiology, and I kept on studying. And in DM cardiology, he found a drug which can lower BP. So all the drug, antihypertensive drug, they does not cure blood pressure. They only prevent people of BP sugar from dying due to that problem. So if people are not being killed, like in BP sugar case, they do not die quickly, they suffer a lot. So because they suffer a lot, duration of disease is more, and because duration is more, so prevalence will also be more. And I hope you are understanding. बीपी शुगर की दवाइयां बीमारी को ठीक नहीं करती है, बस मरने से रोकती है। तो मरने से रोकती है तो लोग लंबे टाइम तक सफर करते हैं। लंबे टाइम तक सफर करेंगे तो किसी भी समय अगर आप टोटल केस देखोगे बीपी शुगर का तो बहुत ज्यादा होगा। व्हाट आई वाज सेइंग इन हिंदी वाज दैट बीपी शुगर मेडिसिन, दे डू नॉट cure the disease, they only prevent people from dying due to it. So because people are not dying due to it, they are suffering for longer time, duration is more. That is why at any time, if you count the total case of BP sugar in any population, that will be high. So duration more, prevalence more for sure. But even if Dr. Bharat Sen found a drug to control BP, will new case of BP sugar stop occurring? Of course not. New case of hypertension or diabetes is occurring because of our diet, smoking habit and other thing. Na? So incidence, remember, is not affected by drug. Whenever they talk about drug, incidence remain almost same. Okay, so incidence is always same when they talk about drug. So correct answer is option 4, which most of you has given. Now, sometime they change the question and they ask, and this time they can change it. They can ask, if a drug cure disease quickly, let's say, someone found a drug which can cure diabetes. They claim it on various channel, that take this medicine, Ayurvedic medicine, it will cure diabetes. So if someone found it quickly, then what will be the effect on prevalence? What will be the effect on incidence? First thing, always remember, incidence is not affected by drug. So incidence will still be the same because new people will develop diabetes due to lifestyle and stress and all. Na? So incidence will again and again remain same. What will happen to prevalence? Prevalence is incidence into duration. Now people are getting cured quickly, so duration is becoming less, so prevalence will also become less. So prevalence will decrease, incidence will remain same. Okay, very good. Then option A will be correct. No, not A will be correct. Remember this thing, no matter which drug we talk about, whenever it comes to drug, incidence almost remains same. New case are affected not by medicine but by social and preventive change. Like in corona also you can see government were mainly focusing on vaccination, social distancing, mask and all, because new case is prevented by social change and prevention method like vaccination and all. So drug has no effect on incidence, only prevalence you have to answer whether increase or decrease. Okay, so if it is quickly treating, prevalence will decrease. Okay, so that is the answer. Very good. Now, highly toxic insecticide is quoted in. What is the answer? If you know, please give. You can see such type of logo also, this type of logo on behind some insecticide. If this is yellow color logo, what is that? If it is red color logo, I cannot draw red over here, no, but I can draw red. If it is red color logo, this red color logo, what is the answer here? Red is, we think, highly toxic, but no, red is extremely toxic. Example is zinc phosphide, which is a rodenticide. It kills rat, but if anybody took zinc phosphide as poison, they will die very painful death. So they have asked this question also, that after leptospirosis which occur after Kerala flood, in Balamuthia district, leptospirosis was there. So because of leptospirosis, patient were distributed, the whole people in Kerala, they were being given doxycycline because this is the drug which will prevent leptospirosis from occurring. But along with leptospirosis, what is doxycycline? What is the other thing which was distributed? And some very good question platform also, they said malathion will be distributed. Malathion kill mosquito. And we all have just read in above question also that in leptospirosis cycle there is rat urine. Rat is involved. And when rat is involved, we need to give zinc phosphide, not malathion. So along with doxycycline, what should be given in those districts? Zinc phosphide should be given. The correct answer is yellow. Yellow is for highly, red is for extremely, yellow is for highly toxic. And if they give you this blue color logo, then this blue color logo is for moderately toxic, and answer of moderately, example of moderately toxic is malathion. Do remember, malathion need to be resprayed after 3 months, and malathion is least toxic organochloride. That is why when we do ultra low volume fogging or space spray, we use malathion. So least toxic organochloride is malathion, 3-month respray. And if they give you this green logo means safe for human use. Like on mosquito vaporizer in your room, you can see this green logo on the behind. Okay, chalo. Now, which of the following is required calcium dose in elderly? If you know the answer, please give it. Is it 1000 milligram, 1500, 800 or 1200? In adult, male, female, then there is pregnant, lactating, old age. We have to remember about 3 things. One is the calcium. One thing more we can remember is iron. One more thing we can remember is iodine. One more thing we can remember is vitamin D. So these 3-4 things they ask. Let's answer all this and remember all of it right now. First thing, if they say vitamin D for everyone, vitamin D is same 600 international unit, same for everyone, same. When it comes to calcium, many of you answer 1000. Very good. 1000 is the answer coming. AAA. Sanjay Prakash is and Dr. Huma Tabassum is saying 1200. Those 2 are correct. So see, it is a confusing one. And that's why I asked this question, and it's a PYQ also. For male, female, we give 1000 milligram. For pregnant also we give 1000 milligram. But for lactating old age, we give 1200 milligram. So which mineral is needed more in lactation as compared to pregnancy? That is calcium, 1200. When it comes to iron, for male it is only 17 milligram needed. For female it is 29 milligram, which is higher than what is needed in pregnancy, because menses loss occur in adult female, not in pregnancy. And then it is around 23 milligram in lactating and old age. Okay. When it comes to iodine, if it is adolescent, we need to give it around 150. So 150 to 180 is for adult male and female. When it comes to pregnancy, it's around 220 to 250. It's around 250 in pregnancy, and in lactation it's around 250. 250 you can roughly say. If you go into more precise data, PARC and ICMR, they both give different data. In ICMR data, pregnancy, they say 250 to 280. Lactating 220 to 250. But in PARC, they have wrongly written it as different. But roughly, you can simply remember 250 is here. 150 for adolescent iodine needed. Okay. And this dose, if you remember, that thing is done. Now, tell me, how much extra kilocalorie is needed per day in pregnancy? Per day in pregnancy, we need how much? 600, 500, 400, 350. How much? 350 kilocalorie is needed in pregnancy. And in lactation, we need per day 600 kilocalorie energy. So pregnant female like me should take how much extra per day? 350 kilocalorie. Do remember it? Very common area of question. Okay, very good. Now, let's move ahead. Next question. In a survey of 10,000 IV drug user in town A, 1,000 turn out to be infected with hepatitis. During 1 year follow-up, 100 patient with hepatitis C infection die. Also during follow-up, 100 IV drug user acquire hepatitis C. Which of the following is best estimate of annual incidence of hepatitis C? So can you find the annual incidence? Again, it's just plus minus thing, not big calculation. So I hope you can do it. See, when we talk about incidence, it is same as cumulative incidence. Incidence or cumulative incidence simply means total new case divided by total people who are at risk of getting infection. That means total susceptible. Total susceptible means population minus those who are infected or immunized. Infected or immunized cannot get the infection again. So if you subtract infected, immunized, it becomes susceptible. Okay. Now coming to our question, you can see total population is how much? Population is 10,000 first line. Then 1,000 are infected with hepatitis C. Okay. 1,000 turn out to be infected with hepatitis C. So how many are infected? Infected is 1,000. Okay. Now, during 1 year follow, 100 patient with hepatitis C infection die. Let them die, no problem. Because there is nothing like death which we write here. And also during follow-up, 100 IV drug user acquire hepatitis C. So how many are new case? These first 1,000 were prevalence. These are old case. New case are 100. 100 new cases there. 10,000 population, 1,000 is already infected. So how much incidence we got? Incidence we got is 100 by 9,000. Option 4 is correct. 100 by 9,000, because 10,000 is there, but we will subtract those 1,000 which are already infected. So correct answer is D. Very good. So it's there. Now, it was a confusing one, but it has been asked, and you should be able to understand this concept and answer such question. Second thing which I want to discuss here is incidence rate. They have asked this question in MCI PYQ only, that there is increasing number of new cases with time. What will you call it? So whenever they use the word time, that is the incidence rate. Actually, the definition of incidence rate is new cases by total people who are infected multiply by for how long they are infected, person into time. So new cases is increasing with time, answer is incidence rate. And cumulative incidence, new case by total susceptible, population minus infected. Okay, chalo, very good. Now let's see this graph, again an interesting type of question. This is a graph in which here they are writing percentage of people vaccinated. This is vaccinated, and this is vaccinated is this side. Vaccine kitne ko lagi? And the vaccination first was 25, then it became 50. So vaccinated people are increasing, and they are increasing with year. In 2010, some people were vaccinated, then 11 some more, 12 some more are vaccinated. So if more people are in fact vaccinated, which of the following hepatitis B statistics is most likely to be affected by the data? If more people are getting vaccination, which of these four will be affected? Hospitalization rate, case fatality rate, median survival, or new case incidence? So why we took vaccine of corona? So that you do not develop the infection of corona, so that you do not become new case of corona. So when vaccination are increasing, which will be affected? Very good, Dr. Nikuraj, GT, Expreet. Both of you have answered it correctly. It is incidence. Because if more people are vaccinated, new case will occur less. So which one is affected? Incidence is affected. Okay, Dr. Mantis is asking to discuss level of prevention. Of course, dear, we have two questions on level of prevention. We will discuss primordial, primary, secondary, tertiary in detail. Okay, but I hope you understand more vaccination. So which will be affected? Incidence. Next question. I hope this is not clearly coming to you. They are saying that lifespan of Japanese women are increasing. Japanese women is 84.3 year. Okay, and why this life expectancy is long? This life expectancy is long because of intervention by the government, due to government facility or government intervention. Japanese people have longest life expectancy of the world, actually 84.3. So this is example of which of the following? Is it example of health adjusted life expectancy? Is it example of QALY, DALY, or DALY is this disability adjusted life year, and option C, disability free life year. Disability free life year is known as Sullivan index. These are the four things which they is confusing and they ask again and again. But this QALY word means life added due to intervention. So as soon as you found the word intervention or government is opening dialysis machine to help renal patient, giving them quality life, answer become QALY. As soon as intervention is there, answer is QALY. What is QALY? Full form is quality adjusted life year, but you have to adjust the word adjusted, remove it. Quality life year is QALY. So year of quality life added due to intervention or increased due to some intervention, that is QALY. And let's say in your batch, suppose Dr. Pradeep Yadav want to help the people of India by giving them hearing aid. Because you know now in old days there is one major problem. Whatever you say to them, they will answer by one word only. So to help them, he want to give hearing aid. So he will go to Modi and say, "Hey Modi, distribute hearing aid to old age people. They will be hearing better and then they will vote for you. And hearing aid increase quality of life by 0.3 year each year." So it's an intervention hearing aid. It will come under example of QALY. Hell is healthy life expectancy. Like healthy life expectancy of my angel girl child Prisha Lakshmi will be less than healthy life expectancy of a Japanese girl. So healthy life expectancy, how many healthy life you are expected to live, that is healthy life expectancy. When it comes to DALY, disability adjusted life year, it has two things: year of life lost due to early death plus year of life lived with disability. Year of life lost due to early death plus life lived with disability. And this was the question in NEET exam 2023 also. What is PYLL? So PYLL means premature year of life lost. Okay. And what is premature year of life lost? You know, this definition came in NEET already. Premature year of life lost means, let's say Indian life expectancy is 70 year. And suppose an Indian died at 62 year. So 62 year is death, 70 year is expected. How many life he lost? He lost 8 year of life. And suppose last 10 year he lived with hemiparesis. So how many lived with disability? 10 year. 8 plus 10, if you do, how much DALY come out? 18 year. So remember, DALY has two things: life lost, life lived with early disability, both the thing. So 8 plus 10, total 18 year is DALY. Now what is Sullivan index? Sullivan index means year of life free of disability. Life free of disability. And option C is there. without disability, how many years you live. And in the formula of Sullivan index, it is life expectancy minus DALY. So in our example, in India, what is the life expectancy? 70 year. And our patient, what was the DALY? 18 year. So if you do 70 minus 18, how much will come out? 52 year. And this is actually the story of my father, who developed hemiparesis when I was in second year of MBBS. He suffered for hemiparesis for 10 years, then he died. And so how many years he was without any problem? Till 52 years, he had no problem. On 52 years, he developed a stroke, ischemic stroke, hemiparesis of left side, and then he suffered for 10 years. So Sullivan index tell how many years he was without problem? 52 years. DALY said how many years he lost plus how many years he was bedridden? 18 years. Okay, so DALY, Sullivan index, QALY, and HEL, 4 thing is there. I hope you will not confuse between them. And you can see, even when I am talking about death of my father, I am not so serious, and because anyway, my father was a cool dad, and I also know, as being a parent, that father, mother want only one thing from us, that we should be happy. They are pressurizing you to clear exam and all because they think after clearing exam you will be happy. So just look at their core feeling, hurt, which is your happiness. And so even if my father is no more, at least I should be happy to fulfill his wish. So we should be happy, no matter what the situation is, because situation can be changing. Our inner happiness should not be dependent on external situation. Okay, because external situation are temporary. It will change. Happiness should always be in our control. And it should not be given in hand of other people. That someone, some relative, some kamina, harami, padosi, some neighbor came and said something bad, and you are no. Your happiness is your decision, your control. Okay, that's maturity, I think. Now, and that's the way. That's the main core feeling, core wish of your parent also. So we should do that. Do remember this 4 thing. Now, let's come here. Rashes shown here in this child is of which disease? So can you see the rashes of this child? First thing are, rashes are in the skin surface, not coming out. If they will come out like beak of chicken, like dewdrops on rose petal, then we call it chicken pox. It is not chicken pox because rashes are in the skin surface and merge with each other. Second thing is, this child is opening the mouth to breathe. That means he might have taken some cetirizine or antihistaminic drug and secretion is dried. So now he is finding it difficult to breathe. And only measles is there, in which there is cough, cold, coryza and secretion. Chicken pox, rubella, both are dry fever with rash. So it cannot be chicken pox, it cannot be rubella, because chicken pox and rubella are dry fever, and in chicken pox rashes come out from the body, do not remain in the skin surface. And it is not vitamin K deficiency. It will have vitamin K deficiency, will have red patches, ecchymosis. So the answer is measles here. Why it is not dengue? Because dengue will have pinpointed petechial rashes, not such maculopapular rash like here. So this is measles. One more hint they give sometime. Measles rash start from back of hair, back of hairline, back of ear, then it go to face and body. कान के पीछे से शुरू होते हैं, कान के पीछे से कान के पीछे है ना, back of ear they will start, then they go to face and body. That will be measles. Second thing they will give is, in measles the thing which is always present is coplic spot. If it is present, diagnosis of measles and only measles is confirmed, and measles coplic spot is white patches near first and second lower molar, because upper molar is the opening of extension duct from parotid gland, lower molar is the measles. Okay, so that's there for measles. If they say rubella, in rubella there is another spot, they call it Forchheimer spot. This Forchheimer spot are pink dot on soft palate. Okay, pink dot on soft palate. Soft palate is that part of your palate which you cannot touch by tongue. On that part there will be pink dot, Forchheimer spot. Hey, don't try, you cannot touch it by tongue. That's soft palate. Okay, don't try, you can't touch it. That's there. If anyone can touch the soft palate with tongue, please let me in the comment box that yes, I can touch soft palate with tongue. Your tongue will be useful in many other things. Please do let me know. Now coming on to this lesion has been asked 2-3 times already in MCI exam. This is the honey crusted lesion. Don't look it up, but it's there. And what is the cause of honey crusted lesion? It's impetigo. Okay. Now, zero growth rate is seen in which stage of demographic cycle? I was doing PYQ of FMGE some 2-3 days back, and I found in every year they are asking questions from demographic cycle. Okay. So, what is the phases of demographic cycle? I hope you all know. When there is first stage, they call it high stationary, and in high stationary, birth rate and death rate both are high, both high. And it's the stage, and you must have heard this story from your grandparent that at that time 10 children used to occur, out of which 6 live, 4 die, 3 live, 5 die, like that. So that is high stationary. Birth was high, death was high. Second phase is early expanding, and I really think that our grandparents were also high at that time. So early expanding, birth rate is still high. And many students told me that this was the question in MCI, that in which two phases birth rate is high. Back. शुरू करें? नहीं? प्रतीक बोल रही है क्या लगा रखा है पीएसएम में, कल भी ऐसा ही हुआ है राइज में. On है? Okay. So sorry for this inconvenience. Today we came back soon. Sorry. Now let's move ahead. इसमें नहीं दिखा रहा है आगे बढ़ते हुए. It's okay ना? So do remember this first two phase in which birth rate is high. In late expanding, in which India belong right now, I hope you all know that birth rate is start decreasing, death rate something which decreases further. So death rate started decreasing in early expanding, start decreasing here, and it decreases further in second, third phase. And you only have to remember second, third differently, because the fourth is very easy to remember. It's low stationary. In high stationary, both birth rate, death rate was high. In low stationary, both birth rate, death rate was low. And last, in declining birth rate become very low. Like most of the European country are in declining already. Birth rate become lower than death rate. So these are the 5 phases. And let's come to our question. The question is saying that zero growth rate is seen in which stage of demographic cycle? So can you answer it? Which phase has zero growth rate? Fourth stage, second, third, or fifth? Fifth stage is not the answer. Fifth stage has negative growth rate. Negative growth rate, because more people are dying as compared to taking birth. Like China last year was also declining. India, after 10, 15 years, India will also be declining. But which stage has zero growth rate? Zero growth rate means stationary. And stationary are phase 4th and phase 1 are zero growth rate. Then they can ask which stage has maximum growth rate. So maximum growth rate is in late half of early expanding. Maximum growth rate, second phase. And in which phase growth rate start decreasing? Growth rate start decreasing in early half of third. So second late half growth rate is maximum, and third early half growth rate start decreasing. These are 2 more questions which they can ask this time. This I am expecting to be coming this time. So do remember, stationary means zero growth rate, first and fourth. Declining negative growth rate, phase 5. Next question, they are saying that there is a child who was brought to you with complaint of fever, malaise and rash. And fever is there, rash is there, malaise means body ache is there. Diagnosis of the child is measles. what is the recommended period of isolation period they are asking. So in measles, in first 10 days, suppose entry happened here of measles virus, then in first 10 days there is prodromal phase. First 10 days it takes around 10 days to develop the symptom. It's not prodromal, it's develop symptom in 10 days. Then from 10 to 14 days, it's prodromal phase in which coplic spot also come. So coplic spot comes in prodromal phase. After this 14, for next 3 days, rashes is there. So rash is between 14 to 17, and after 17 days, disease start decreasing. So this prodromal means the cough, cold, coryza occur here, and rash start at around 14. So isolation in case of rabies is done 4 days before rash and 4 to 5 days after rash. So this prodromal is also known as catarrhal stage. From catarrhal stage, 4 days after rash, this is the time when you isolate the person. Isolation is done in diseased people, and isolation is done till period of infectivity, till they can infect other. So in case of measles, it is 4 days after catarrhal or 4 days after prodromal stage start and 4 days after rash also. So total around 8 to 9 days is the isolation, 4 days before, 4 days after. So from catarrhal stage to 4 days after rash, you can say, is the period of isolation. Do remember it. And one more thing which is very important to remember is that measles vaccine, if you give, this is the only vaccine which give immunity before appearance of symptom. It induce immunity in 7 to 8 days. And measles symptom come in 10 to 14 days. So 10 to 14 days is the incubation period in which symptom come. So before symptom come, immunity develop, antibody sipahi develop before symptom come, only in one disease, that is measles. But do remember, measles vaccine is not given during disaster, because during disaster the most common disease is hydrological disease. Measles is anyway not common, and the doctor and nurses are less in number. So if you will engage them in vaccination, then who will save the life? So during disaster, remember this thing, no vaccine is given to general public. No vaccine to general public is given in disaster or post-disaster phase, except for the routine vaccine of the children which is being given. But no vaccine is given during disaster or post-disaster. But to health workforce, to doctor who are going there and doing the work, for them, WHO and PAAR has written that 3 vaccines are given. One is tetanus, one is typhoid, and one is cholera. So 3 vaccines are given to health workforce, no vaccine during disaster to general public. Okay, they ask a lot of questions from this part. Do remember, this is the recent guidelines. Now, which contraceptive image is shown here? First of all, this contraceptive which is shown is 2nd generation or 3rd generation. See, 3rd generation of IUCD is hormonal IUCD. And when it is hormonal IUCD, hormone cannot be stored without plastic. So whenever they give hormonal IUCD, you cannot see the metallic part. You can see only metallic part in 2nd generation IUCD. So this is definitely 2nd generation IUCD. And in the 2nd generation IUCD, there is copper T380 AG also, multi-laid 375 also. Lipley's loop is 1st generation. And the problem with Lipley's loop was, ये loop से निकल आता था. It has very high expulsion rate. So this Lipley's loop is no more in use. And when we use copper to T380 AG, it has 10 years of protection. So if they ask what is the ideal emergency contraceptive, which they have asked in last MCI exam, ideal emergency contraceptive is IUCD, because IUCD can protect us even up to 5 days of unwanted conception. And this second generation will have metallic thing there. Multi-load 375 protect for 4 to 5 years. And we all know that IUCD, this has been asked also, should never be inserted during menses, because during menses there is no chance of pregnancy, and during menses if you put IUCD it will come out, expel out. So we do not insert IUCD during this, and these are second generation with wire. How does IUCD work? The main mechanism of action of IUCD is spermicidal. फिद्दे मर जाते हैं हमारे, है ना, our sperm cannot survive those foreign materials and they die. And what is this 380? 380 is the area of copper T in millimeter square, not centimeter square, millimeter square. Okay. Also remember that if they ask what is the most common complication of IUCD, the most common complication is bleeding for IUCD. But if they ask what is the most common cause of removal of IUCD is pain. So you can remember it by PR, pain removal, PR. PAAR or per rectal examination is removal. Two more thing is that in IUCD when we are inserting, we can take the infection of the vagina to the cervix. So IUCD increases PID, and because IUCD is in the uterus, so no pregnancy can occur in uterus, so pregnancy will occur in fallopian tubes and all. Therefore, IUCD also increases ectopic pregnancy. And because these two are increased by IUCD, so these two are decreased by OCP. OCP decrease PID, OCP decrease ectopic pregnancy, OCP also decreases ovarian and uterine cancer or endometrial cancer. O for OCP, O for outside. So outside cancer is increased by OCP like breast cancer or cervix cancer, but inside cancer like ovarian and endometrial are decreased by OCP. Okay, so this part is very important to revise about their side effects and the problem. This question has come, and I hope you all know when it comes to type A PHC, it's always less than 20 delivery. So you can remember type A 19, type B 20 or more than or equal to 20 delivery. Second thing is that whether it's type A or type B, in all PHC there will be two doctors, one MBBS, one Ayush doctor, and there will be 3 to 4 nurses at PHC, plus there will be a lab technician, a pharmacist, and health assistant, male and female, and there will be other cleaning staff, guards and all. So these all are the staff, and PHC is 6 bed presently in India, and there are 2 delivery table, and there is 1 newborn care corner at PHC, where we rub the child and make him warm. So do remember. Now when it comes to sub center they can ask about type A and type B. In type A there is no delivery can occur, in type B delivery can occur. Second thing is that in both type A, type B subcenter, we do conduct the ANC checkup, immunizations, and give the medicines. So in type A, there is usually 3 staff. Earlier, now they have added one more thing, CHO, community health officer. So there are 4 staff here in type A, and there are 5 staff in type B. If they come to CHC, CHC is A when it is 99 or less delivery. CHC is type B if it is more than or equal to 100 delivery. Okay. So always remember that at CHC is the first referral center. It's not PHC which is first referral. It's CHC, first referral. And PHC and sub-center are primary level, CHC is secondary level of facilities are there. Now, let's come to the next question, which is from micro core, but we can also discuss it here. Which is correct for antigenic drift? If you know the answer, please give it. In influenza, remember, SIFT and drift, both are for influenza virus. SIFT, let's say you are going on in a ride on a car with this good speed, enjoying the music and all, and suddenly you had an accident, your car toppled upside down and went on the wrong side of the road. That big thing is shift. So shift is sudden and shift is large change. It is due to recombination of gene or reassortment of gene. You, after that accident, you became totally disturbed and all. Recombination and reassortment is there. But drift is a small thing. Like suppose you are drifting a car around a girl to impress the girl. So drifting is also sudden, but it's not such big thing. It is small change in gene. And this small change in gene is due to point mutation. See, if you will drift your car around a girl, the girl can naturally select it. So this natural selection can occur with drifting, and that can lead to point mutation, leading to point mutation. So drifting is small, shifting is big. Now, drift occur in type B influenza virus and in type C. And drift can lead to some seasonal epidemics of influenza, small epidemic. But shift are big thing. Shift can occur in type A or type B. And when shift occur in type A, then that lead to pandemic. So they can ask which influenza virus is most common. Most common influenza virus is type A because it is leading to pandemic. So type A influenza is most common. And what is the drug of choice for influenza? The drug of choice is oseltamivir. So now let's come back to the question and try to answer it. For drift, they are saying only seen in influenza type A. No. Drift is in type B, type C, not in A. This is wrong option. Drift is result of frame shift mutation. No. Drift is due to point mutation we just have read. So this is also wrong. Drift does not occur due to natural selection. Actually, drift is when you drift, girl will naturally select you. So drift is due to natural selection. Not word is wrong. And last is drift is responsible for seasonal epidemic of influenza. This option D is correct. Drift can occur in BC, which can cause seasonal epidemic of influenza. So do remember drift, shift again and again ask in micro PSM both. Now coming to the next question, they are saying BCG vaccine protect against which of the following? BCG vaccine do not protect us from every kind of TB, but the dangerous type of TB, which is in the nerve and disseminated TB or miliary TB. This is prevented by BCG vaccine. Second thing they can ask are the diluent. With BCG, the diluent is normal saline. And the dose of BCG is not 0.1 ml, it is 0.05 ml if it is given up to 1 month. Previously it was 1, now it is 0.05. Then with MR, the diluent is sterile water or distilled water. And with JE, the diluent is phosphate buffer solution. So how to remember it? Very simple. As soon as the child is born, we will give BCG. We will try to make the life of child a bit salty. है ना, बच्चे की जिंदगी नमकीन बनाना चाहते हैं. We give him normal saline, try to make the life salty as soon as birth. Then M for MR, M for mother love. And we all know mother love is like sterile water. So sterile water MR. And JE, if you write the full form, it is Japanese. So JE will have phosphate buffer solution. Okay, do remember these three diluents. Second thing they can ask is the route where we give the vaccine. So JE and MR, this has been asked, both of them are being asked already. Both are given subcutaneously, 0.5 ml. But JE is given on left arm and MR is given on right arm. How will you remember? Again, M for MR, M for mother love. And mother love is always right. So mother love right side, JE left side, both subcutaneously. Then there are two vaccines given by intradermal route. One is BCG, other is FIPV. BCG we all know is given in left side, and when it is given at 2 weeks, there is formation of abscess. Then at 4 weeks, there will be ulcer. And at 6 weeks, there will be scar. So left side is totally busy. Therefore, FIPV will given on right side, right deltoid intradermally. Which vaccine is given by nasal drop? Nasal drop is for influenza live vaccine, and nasal drop is also for Incovac vaccine, which is by Bharat Biotech, same company which produced Covaxin. Rest all of the vaccine are given by IM route except rotavirus and OPV, which are given by oral route. Okay, so do remember the route also. Next question is regarding ESI. We have to revise it. In ESI, employee gave 0.75, employer gave 3.25 of total ESI contribution. This is correct. Employee give 0.7, employer give 3.25, so total become 4%. Okay. Then state government do not give 7/8. State government give 1/8 of fund, and central government give 7/8. So who is the main funder of ESI scheme? Central government. You can see 4% is employee plus employer, around 12.5% from state government, and remaining 83.5% come from central government. So both state and central contribute to give ESI. Similarly, both state and central contribute to give Ayushman Bharat fund also. Both of them contribute. And one more thing is that Food Safety Standard Authority of India, which comes under Ministry of Health Family Welfare, this is also funded by both state and central government. Okay, and come under both state and central list. Now, which of the following is correct for demographic bonus? So there is two things, demographic bonus and demographic burden. See, bonus sometimes is also known as demographic dividend. And we all know bonus is a good news. Now, whenever bonus come, we used to celebrate. So bonus means good news. That means dependency ratio should be less. If it is less people are dependent, then we are in demographic bonus or demographic dividend. And that means correct answer is only C or D, decrease in dependency ratio. Now, can you answer me C or D? Which one is correct way of decreasing dependency ratio? Dependency ratio means in the numerator, we will write those who are less than 15 years and those more than 65 years. They are the one who are dependent. They are dependent on which people? Young people who are 16 to 64 years. So how can you decrease dependency ratio? One way of decreasing dependency ratio is let's produce less children. If we produce less children, fertility will decrease and we have less dependent people. So how will you get demographic bonus? By decreasing dependency ratio and fertility both. Now let's talk about demographic burden. Can you answer me out of A, B, C, D, which is the way of increasing demographic burden? So burden is a bad news. Burden will be there if dependency ratio increases. So either A or B will be correct. Now, how can you increase the burden? By producing more children who are less than 15 years. So if increase in dependency ratio, increase in fertility is there, that is demographic burden. Option A is demographic burden and option D is demographic bonus or demographic dividend. Okay, I hope you will remember it. Yeah, isko charge mein laga dena Nikhil bhai, battery low. Now coming to next question. This image is shown here of white teeth. 2 times it has been asked with white plaque. This is due to excess of fluorine in water. This fluorine in water should be 0.5 to 0.8. It is simple to remember because chlorine is also around same 0.5 to 0.7. And if fluorine is less than 0.5, क्या होंगे? Dental caries, दांत सड़ जाएंगे. That's why we should brush our teeth twice, because at least toothpaste have fluoride, that will save us. And if fluorine is more than 0.8, it will lead, one thing is the dental fluorosis, which is shown here. Second thing, it will lead to brittle bone. And third thing which can occur with it is anemia, very common. So if brittle bone will develop, let's say you are an orthopedician, patient of 60 years will come and say ki, sir, in the morning I was sitting in toilet, I had fracture. I came out from toilet, I had fracture. And a very easy type of fracture. So what advice will you give? Will you give them advice to defecate in a standing mode, like walk and defecate? No, no. The advice which you give is remove extra fluorine. And to remove extra fluorine for defluoridation, the technique which we use is Nalgonda technique. And in Nalgonda technique, we add three things in water: lime, alum, bleaching powder. So the mnemonic is lab. First you add lime, then you add alum, then you add bleaching powder, and extra fluorine will go away. So that's there for fluorine, do remember. Now next question is, there is a study is performed in which mother of babies born with neural tube defect are questioned about their acetaminophen consumption in the first trimester of pregnancy. At the same time, mother of baby born without neural tube defect are also questioned. So which type of study is happening here? One are those which have neural tube defect, mother of baby with neural tube defect, these are the case. And one are the baby without neural tube defect. See, there are two groups, one with disease, one without disease. So without disease will be the control. So this is a case control study, and you are asking about their past history of consumption of acetaminophen during pregnancy. So in a case control study, which of the four we will get? What is the answer here? Which we will get here? Prevalence is something which we get in cross-sectional study. Cross-sectional study is done in present moment. And prevalence means total case at present moment, old plus new. That is why cross-sectional study is known as prevalence study. And there is one more name of prevalence study, snapshot study. Because we cannot take picture in past or future. We can take it right now only in present moment. So cross-sectional snapshot study, prevalence present there. Median survival is something which we calculate in drug trials and RCTs, how many times the patient survive and all. It's not here. Relative risk and incidence, these are the thing which is coming in cohort. Because new cases, like when will you have your new boyfriend, girlfriend, in future or in past? Of course, in future. So in future, we go in cohort. That's why we get incidence, relative risk, attributable risk, PAAR. And in case control, we get odds ratio. Now my question is, in which study we get cross product ratio? This question has also been asked. Cross product ratio is obtained in which study? So odds ratio is the same thing as cross product ratio. Don't think cross product is in cross sectional. No, odds ratio is in cross product, is the same thing as cross product ratio. And because in odds ratio or cross product ratio, we do AD by BC, multiply them cross. That's why it's cross product ratio. Do remember this thing that there are famous studies like Framingham Heart study, in which doctors are being given letters, not love letters, questionnaire for 54 years, and they were being asked that, do you kya tum sutta phukte ho, do you smoke, do you drink, and do you have heart attack and all. So this Framingham Heart study find out risk factor for MI, and this Framingham Heart study went in future. So this was a very good example of cohort study. There is one more cohort study, Doll and Hill. This proved that smoking causes cancer. So Doll and Hill study with smoking and cancer and Framingham, both are cohort study, very famous cohort study. And whenever they say neural tube defect or any congenital birth defect, only case control can be done there. But the exam question came on this part is, what was Monica study? Do you know what was Monica study? Was it case control, cohort, cross-sectional, which type of study? And in one exam, what is the full form of Monica? They also ask. So Monica stand for monitoring of trend and determinants of cardiovascular disease. Cardiovascular disease. And this name Monica must be given by either a very Turkey scientist, very pervert scientist, or someone who was a lover of Monica, because who took Moni from here and Ka from here and made it Monica. So the full form they have asked, that's why I write it. And in Monica, they asked this question from a big population about whether they smoke or drink, whether they have diabetes or hypertension in their present life or not. So Monica was a cross-sectional study. It was a cross-population survey, and it was a cross-sectional study, Monica. Okay, do remember this famous study they ask. Coming to the next question, a screening test is developed for gastric cancer. This test is developed in United States, and in United States, the incidence of gastric cancer is 7.2 per lakh. When the screening test is used in America, the positive value is 70% and the negative predictive value is 95%. The test marker wishes to use the test in Japanese population. Japanese, where gastric cancer is 4 times more common. So if gastric cancer is 4 times more common, what will happen on sensitivity, specificity, PPV, and PV? Do you know the answer? What they are trying to say? They are trying to say is, as compared to America, prevalence is more in Japan for gastric cancer because they are eating more spicy food and all. So gastric cancer or gastritis is more prevalent in Japan. So if it is more prevalent in Japan, which thing will be affected? First thing is, this sensitivity and specificity, they do not depend on how many people are suffering from the disease. Sensitivity and specificity are fixed for a test. Okay, but prevalence is something which is dependent on positive predictive value. If more people have gastric cancer, prevalence will be more. And if prevalence is more, PPV will be more. So do remember this thing. What will affect it? C, positive predictive value will increase. Sanjay Prakash gave the answer correct. Very good, my friend. Pratik Mane, Pratyusha guessed they were right, correct. And Mantis also, Dr. Mantis also gave the answer correct. Very good. Now, do remember 2-3 things more. First thing is that when they ask the formula to identify for sensitivity and specificity, it's very easy to remember the formula. Sensitivity, we all know true positive is in the numerator, specificity has true negative in the numerator, above part. If you remember this much only, in the denominator, again you will write true positive and just opposite of that. What is the opposite of true? False. What is the opposite of positive? Negative. So the formula of sensitivity is true positive and just opposite of that, false negative. Formula of specificity, true negative and then just opposite of that. What is opposite of true? False. Opposite of negative? Positive. So this is the formula for specificity. And sensitivity is most important criteria for screening test. Because in screening test, we try to include as many patients as possible. So sensitivity is for screening test. Specificity is most important for diagnostic test, confirmatory test. We take specificity. And sometimes they ask which criteria decide accuracy of a test. So accuracy is known as diagnostic ability of a test. So accuracy or diagnostic ability of test depend on 3 things. Which 3 things? It depend on sensitivity, it depend on specificity, and it also depend on prevalence. And because it depends on prevalence, that means it will decide the PPV. So accuracy depend on all of these 3 things. Do remember it. Now, let's read the next question. It's being asked that suppose you are a medical officer in charge of a PHC and you came to know this news that A&M are not working in your area. So you went there at the sub-center in plain area as a part of audit. How many pregnancies should be there in the health worker working there in a year? How many pregnancies should be in the register? How many pregnancies present there? You will be sure that A&M is working. How many pregnancies should be there? That was the question. If you know the answer, please tell me the answer. To answer this question, first thing is that uh, we have to know the birth rate in an area. See, birth rate is given here as 20 per 1,000 and sub-center is in plain area. So plain area means how much population is there? 5,000. Hilly area 3,000. So population is 5,000. Birth rate in a year is 20 birth rate in 1,000 people. So in 5,000, how many birth will occur? 20 into 5, 100 live birth will occur. Simple. Whatever they will give the birth rate, multiply by 5, you will get the live birth in a year. This is first step. Multiply by 5, you will get the live birth 100. But does all pregnancy go till delivery? No. In some of the pregnancy, there is abortion and stillbirth also. The second step is when we are trying to find pregnancy in a year. This is total live birth and 10% of live birth. This 10% of live birth indicate pregnancy wastage factor, because some pregnancy, as I said, will be wasted in abortion and stillbirth also. So it's 10% always, pregnancy wastage factor. What is the live birth in our example? 100 plus 10% of 100. What is 10% of 100? 10. So total will come 100 plus 10, 110. This should be pregnancy in a year. And correct answer is option D, 110. But sometime they ask you one more thing, that at any time when you will visit the sub-center, at any time, how many pregnancies should be in the register? How many pregnancy in register? So, see, pregnancy come for first visit. Total how many ANC visit are there? This has been asked. ANC visit is minimum 4. But if they ask WHO ANC visit, how many is there? WHO ANC visit is total 8. And the first ANC visit occur at 12 weeks. That means 3 months is gone. And pregnancy is only for 9 months. So if you subtract 3 months from 9 months, it is total 6 months for which pregnancy name will be in the register, only for 6 months. And in a year, there are 12 months. So half of year, half of 12 is 6. So pregnancy, if they ask this question at any time, how many will be there? It will be half of yearly pregnancy. Why? Because yearly there are 12 months and pregnancy remain only in register for 6 months. So at any time, if they ask how many pregnancy will be there, it will be 102, 10 by 2, 55 will be the pregnancy at any time in A&M register. So if they ask at any time, then answer will be 55. Otherwise, the answer is 110. Now, let me ask this one question which came in MCI exam, that birth rate is 25 per 1,000. Okay. How many pregnancy in a year? In a year at 5,000 population sub-center. How many pregnancies should be there in a year at 5,000 population sub-center? Option A, is it 100? B, is it 125? C, is it 138? D, is it 69? What is the answer? Birth rate is 25. How many pregnancy in a year should be there at 5,000 population? This was the PYQ of MCI. Please do reply, my friends. I am waiting for it. Do give the answer. See, one thing is sure, that because birth rate is 25 per 1,000, so we can simply find live birth in a year will be 25 into 5. It will come 125. And they are asking pregnancy in a year, not live birth. And pregnancy in a year is live birth plus 10% of live birth. So live birth is 125 and 10% of 125 if you will do, it will come 12.5. So 125 plus 12.5, it will roughly be 138. Will be 137.5, but we cannot have 0.5 delivery, so it will come 138. Okay, very good. Dr. Mantis is correct again. It is C. Okay, chalo. Now next question is, in a case control, several case control study find out that association is between aspirin use and colorectal cancer. Okay, researcher planned a randomized trial with aspirin and placebo. So what is the advantage of randomization? They are asking. Why we do randomization? See, randomization means people will come and they will choose chit. If they choose chit A, they will get aspirin. If they choose chit B, they will get placebo. So they are randomly going in the two group. So if they are going randomly in the two group, it cannot be that only young people will get aspirin and old people will get placebo. Young and old will get mixed. Any kind of external factor which is causing the problem will get mixed, and confounding will go away. It will decrease confounding. Who decrease confounding? Randomization decreases confounding. Okay. For example, let's say if you are trying a new drug to decrease obesity, and your new drug you gave to young people. So young people have some more energy in them and they want to reduce their weight themselves. So they will have more weight loss. And let's say you gave the old drug or placebo to those people who are anyway old. So because they were old, they will have less weight loss, not due to taking old drug, but because of their age. So this young age is related both with exposure, which is new drug, and it is also related with the outcome, that is more weight loss. So the one external factor which is related to exposure and outcome both, this is known as confounder. Confounder is related to exposure and outcome both. Second thing is, confounder is unequally distributed. It is young in one, old in other. That is why it is causing the problem. So if you randomly allocate them, young and old will get mixed and confounder will remove. There will be decreased confounding. Okay. So how to decrease confounding? By randomization. Second way is matching. If you match them, and young in other, old in other, if you are giving new drug to 25-year male, placebo you will also give to 25-year male. So by matching also you will remove the effect of confounder. But best way is randomization, by which we can remove the effect. So now coming to next question, they are saying that there is a new drug for influenza, and if it is given in 24 hours of symptom onset, there is few hospitalization, few days of mechanical ventilation and all. So the major adverse effect is 1% chance of aplastic anemia which can occur with that drug. So a local community laboratory has 4 available rapid screening tests for influenza. All tests provide immediate result and have been studied during the first 24 hours after the symptom. Performance of test is shown in the following table. Sensitivity and specificity is there. Okay. So these are the 4 tests A, B, C, D. The question they are asking is, which test, and these 4, 90, 45, 50, 25, these are sensitivity. And remaining 4, these 4 over here, these are the specificity of the 4 tests. Now the question they are asking is, how will you use them? Which test you should do first? Which test you should do after that? So the first test is a screening test. and screening test should be highly sensitive, है ना. हम लोग कहते हैं ना ये बंदा बहुत सेंसिटिव है, बंदी बहुत सेंसिटिव है, दिस बॉय और गर्ल इज सेंसिटिव. सेंसिटिव मींस he can include other people pain in their life. So sensitivity need to be high for good screening test. We have discussed it that screening test depend on sensitivity, and it should have high sensitivity if it is a screening test. So sensitivity need to be high for good screening test, and specificity need to be high for good diagnostic test. Confirmatory test, we need more specificity. So when they ask how to do this test, first you will do that test which has high sensitivity, and high sensitivity is in test A, 90%. Okay, after choosing test A which has high sensitivity, second time you will choose that test in which specificity is high, and specificity is high in B and D. So we will do test A, which will include many people, and if some people are wrongly included, test 2 being specific, it will remove those who are wrongly included. अगर कोई गलती से आ गया सेंसिटिव ज्यादा होने के चलते, तो स्पेसिफिक टेस्ट उनको निकाल के बाहर कर देगा. स्पेसिफिसिटी will remove those who are wrongly included. So the first test will be test A, followed by test B or test D. But there is no option of followed by test D. Therefore, what will be the correct answer? First, we will do test A, which has 90% sensitivity. Then we will do that test which has high specificity, that is test B. Okay. Now, coming on to the definition of SMR, on which a numerical also came in recent MCI exam. Standardized mortality rate means observed death by expected death multiplied by 100, है ना. Suppose you want to get fund for helping the poor children who are working in streets. So how will you get fund for them? First, you will call all the hospital and ask how many street children are dying in a year out of 10 to 15 year age group. And you suppose came to know that there are 30 deaths for every 1,000 street children who are 10 to 15 year and working in street. Then you will compare this 30 death out of the death of normal 10 to 15 year Indian children. This is expected. We already expect that 3 out of 1,000 10 to 15 year normal children will die in India. So whatever is Indian death, that is standard death, that is expected. And what you found in that small population, that is non-standardized population, that is observed death. So this standardized mortality rate will come 30 by 3 into 100, or it will be 10 into 100 or 1,000. So with this data, suppose you are in Rajasthan, so you will go to the chief minister, and which is Mr. Bhajanlal, and you can say, "Hey Bhajanwa, give us some fund to help the street children, because the standardized mortality rate in street children is 1,000 as compared to normal children. So you can get some fund to help those children who are oppressed, in which the death is more." So what is the formula? Do remember, SMR is observed by expected death. This is the formula of SMR, standardized mortality rate. Sorry for the cough. Percentage of total number of deaths that occur in a population to the number of deaths that is expected to occur, that is standardized mortality rate. And standardized mortality rate is the best mortality indicator. So do remember this formula, on which small numerical can come. They can say that observed death in your village is 6, but observed death in national data is 3. So how much is the SMR? 6 by 3 into 100 or 2 into 100? 200 is the SMR will come out. That was the numerical which some students said came in the exam also. So remember, SMR is the best mortality indicator, and it is observed by expected into 100. Now next question is, to understand the relationship between weight and height of a group of school children, how you will represent the data. So whenever they say relationship, it means they are talking about correlation. Correlation tells about direction of association between two variables. Okay, and here they are saying height and weight association. So if you plot height here, weight here, suppose you are plotting weight here and height here, then as height increases due to bone weight, weight also increases. So this is which type of correlation? This is positive correlation because it is going in the above direction together. And this positive correlation is telling that they have a same direction, more height, more weight. So which can tell us correlation? Correlation is told by scatter diagram, chitraya hua diagram, as you can see here. So correlation is scatter diagram. Okay. Pictogram is the simplest method of data representation in which we draw picture and then tell something. Let's say you want to tell that, suppose you are drawing this doctor, this is a doctor, and you are saying that this is doctor. And you are saying one doctor is at 1,000 population. That's what WHO criteria is, and one doctor is at 5,500 Indian. So this type of diagram will be pictogram, and it's the simplest method. Okay, and we already know, I hope you know, pie chart is the diagram in which we can represent the balanced diet also. When we divide a circle into percentage and then represent data, that's pie chart. Now, what is the content of ethanyl estradiol in low dose OCP? Sorry. See, low dose OCP have 20 microgram ethanyl estradiol plus 150 microgram or 0.15 milligram levonorgestrel. This is low dose OCP. If it is normal dose OCP is Mala N and Mala D, which is free of cost, which is chargeable. Mala N is free, and Mala D, D for Dukan, is sold at 3 to 5 rupees per strip. So Mala N will, or Mala D, both of them has ethanyl estradiol 30 microgram. 10 more, and the levonorgestrel is same as low dose, that is 150 microgram or 0.15 milligram. Sometimes they can write microgram as mcg also, that is the same thing, and you have to remember the units, they confuse you in the unit. So 150 mcg is same as 150 microgram. Remember, progesterone is same in low dose, normal dose, only estrogen is 20 less. And in Mala and Mala D, we also use ferrous fumarate because 21 day we give OCP, then for remaining 7 day we give ferrous fumarate. So let's say, suppose I am a female and I came to you for taking OCP, and today is the first day of my menses. Okay, you can see I'm a bit down also now. So from which day I should take the first dose of OCP? First dose, because I will have bleeding for 3-4 days. So first dose should be taken from 5th day, and then it should be taken for 21 next day. After that, I should give a gap of 7 days in which I will take ferrous fumarate tablet of 60 milligram. This will have iron only 19.5 milligram. Whatever is the chemical written, 1/3 is iron. So that is in normal dose OCP, 19.5 milligram iron. And when I will take this iron, in that time my bleeding will occur, and then again from next cycle on 5th day I will take first tablet for 21 days. So this is the doses for Mala and normal low dose OCP. But they ask the dose for IPIL also. I hope you remember. It is 10 times the dose of normal OCP or low dose OCP. Normal or low dose is 0.15. Here it is 1.5 milligram levonorgestrel in IPIL. But there is one more type of IPIL in which we give 0.75 milligram in 72 hours and then second tablet in next 12 hours. Okay, next 12 hours, second tablet. So this two doses, two type of eye pill are there in the market. But in India, mostly 1.5 milligram is being given, but second type can also be given. Now, mid-year population is not a denominator of which of the following. See, when we write proportional mortality rate simply means that out of total death, how many deaths are due to this disease? Okay, and we multiply it by 100. This is proportional mortality rate. It does not have mid-year population as denominator. Sorry for the cough. So, what does proportional mortality rate means? See, proportional mortality rate for cardiovascular disease is 58%. 58% means if total death in India, let's say 100 happened, then out of this 100, 58 people will die due to cardiovascular death. So what is proportional mortality rate tells us? PMR is telling us burden of disease out of total death. Out of total death, how many people are dying due to that disease? This is being told by proportional mortality rate. And whenever we take mid-year population, when do we measure it? We measured it on 1st of July. Okay? Not on 7th of July. 1st July. Next question is, in a school health program in India, it comes under which of the following? RBSK, Ayushman Bharat, Midday Meal or Integrated Child Development Scheme? I hope you all know. RBSK, Ayush Doctor, Anganwadi and Asa worker, they screen for 4D. And what are the 4D? Disease, deficiency, developmental anomaly and congenital birth defect. So they can ask which of the following is not a D. So you should remember what are the 4D. Defect since birth, developmental anomaly, deficiency and disease. And a school health program come nowadays under Ayushman Bharat, and a school health program also come under PHC Vision Center. Why Ayushman Bharat is looking at a school health program? Because in Ayushman Bharat, they are making this health and wellness center. There are 3 things in Ayushman Bharat. I hope you all must be knowing it. Let's have a very quick revision. The first thing in Ayushman Bharat is health and wellness center, in which they will upgrade PHC and sub-center. And when they will upgrade PHC and sub-center, they will give some new benefit. What are the new benefit they will give? One is dental health benefit. Then there is mental health benefit, mental dental, ENT benefit, old age geriatric benefit, palliative care benefit, and finally they will also give yoga, क्योंकि योगा से होगा, है ना? Take a deep breath in, don't let it go out. So these are the extra benefit given health and wellness center. Now in a school health program, we are celebrating, this is the second thing, school health program under Ayushman Bharat. First is health and wellness day. School health, we are celebrating health and wellness day. This health and wellness day will be celebrated on Tuesday, on which student will be health and wellness messenger, teacher will be health and wellness ambassador, and they will motivate a student for yoga. So this is the second thing in Ayushman Bharat. The third thing in Ayushman Bharat is Pradhan Mantri Jan Arogya Yojana, in which there is 5 lakh health insurance for which category of people? BPL or economically weaker section? This is for economically weaker section. After they admit in a hospital, they will get the benefit. Is it for private hospital or government or both? In both private and government hospital, they will get the benefit. Okay? Secondary and tertiary level. So these 3 things come under Ayushman Bharat, which is funded by both state and central government. Now the most sensitive index for surveillance of recent malaria transmission is infant parasite rate. See, if you took blood sample of less than 1 year child and you found plasmodium in them. It means malaria is transmitted in last 1 year only, na? Only then infant have it in their blood sample. So infant tell about recent transmission. But if they ask which tell about endemicity, spleen rate tell about endemicity of malaria. Endemicity of malaria means if malaria is present for a very long time in an area, that then spleen of most of the children will be enlarged. So spleen, out of 100 children, how many have enlarged spleen? That will tell that in that area malaria is for how many years, and it will tell whether malaria is endemic in that country or not. Endemic means constant presence in expected number. Like if we are expecting 50 cases each year, this is expected, and this year suppose malaria 48 cases occurred this year. So this 48 cases are expected within 48 occurred. So this means malaria is endemic, constantly occurring in the population. Now there are two more indicators which we should know, API and ABER. When we write API, annual parasite incidence, I for incidence, I for impact. API tell impact of malaria control program. It simply means out of 1,000 normal population, how many confirmed case of malaria is there? Confirmed case of malaria. And if API is more than 1 per 1,000 or equal to that also, it means state is in intensive control phase. See, let's say you became medical officer in charge of a district, CMO of a district. So first thing you want to know whether malaria is recently spread or not by taking infant sample, you can know it. Second thing you should know it, as compared to last year, is case decreasing or not. Suppose last year API was 5, this year API is 2, it means case is decreasing. So API tell us impact of malaria control program. But it all depends. Now, what do you think? In your area, out of 1,000 normal people, how many will have malaria? At least 20-30 will have malaria. But API only 1 and state is in intensive control phase. Why API is reported so less? Because very less slide are being made by MPW. So the final third indicator is ABER, annual blood examination rate. This annual blood examination rate will tell us whether work is happening at ground level or not, whether MPW is making slide or not. So ABER tells about operational efficiency. Okay, operational efficiency, work is happening or not by ABER. And what is the formula for ABER? It simply means how many slide made out of fever case, number of slide made from fever case. Okay, out of total population, and we multiply it by 100 because ABER comes in percentage. Minimum 10% slides should be made. So what are the 3 steps in which we detect malaria? First, recent by infant parasite. Then we detect impact of malaria program, whether it is decreasing or not by API. And then we detect whether people are making slide or not by ABER, annual blood examination rate. Okay, so do remember it. The 3 indicators which they ask again and again. Now, next question is that in a system we are continuously counting birth and death, and then someone again come, independent survey occur, and then it is counted again. So in which of the following we do dual data reporting? Dual data reporting is done in SRS. SRS is done data, first health worker collect data, then supervisor again collect it, and then they check it and reconfirm data is released every 6 months. So sample registration system which give us IMR and MMR data, this is done by double data recording method, which is shown here. Dual data recording method, double data recording method. Census do not give death data, do remember. Census give us data of sex ratio, caste data, socioeconomic data. Okay, and National Family Health Survey, this NFHS and DLHS, NFHS and district level health survey, these two, NFHS and DLHS, they give us immunization data which has been asked, plus breastfeeding data, domestic violence data, anemia data. These all data come from NFHS, DLHS. And I hope you all know, birth death are registered at PHC within 21 days, and these registration is done under civil registration system. Okay, and sub center register our marriages in village. In city we register it, and district sub-divisional magistrate office, SDM office. Okay, so this is for PYQs which came from here. Secular trend of disease is, we say it like commonly that this leader is secular, this leader is communal. What does it mean? Secular leader is one who is constant for all religion for a very long period of time, not just before election but also after election. So example of secular trend is cardiovascular disease, which is constantly increasing in world since 1950, then 60, 70, 80, 90, again constantly increasing. That is secular trend. And how do we represent secular trend? So this secular trend example, they ask cardiovascular disease, and you can see here it is represented by line diagram. Okay, so who is the secular leader of India? Who do you think is secular leader of India? I was asking in a class and the student said Modi. I said, yes, Modi is secular and I am Noora Fatehi. Okay, so do remember the example, and secular means constantly increasing or decreasing without much fluctuation. Next question is, which of the following is not telling about utilization rate? So, sorry for the cough. If length of stay is long, it means bed are utilized. Bed turnover ratio tell us that per bed in a month how many patients were allotted. So it is telling that bed are utilized or not. Bed is occupied means utilized. But population bed ratio, it do not tell about utilization. For example, many hospital like in Lady Harding in Delhi, it is mainly for pedia and medicine people, patient, which come pedia and gynae patient go to Lady Harding mainly. And medicine ward has a lot of bed, but it is not being utilized. So this population bed ratio do not tell us the utilization rate. It only tell how many bed are available. Okay. Sure. So these three tell about utilization rate. So now, true about sentinel surveillance. Which is true about sentinel surveillance? Sentinel means, can you tell me the answer? Which is true about sentinel surveillance? Sentinel means two things. One thing is active, where we go and search for hidden case. That is active surveillance. So active surveillance is for hidden case which are not coming to hospital. And second component is passive. Passive surveillance are those which are coming by themselves to hospital. So passive means people who are coming and notifying themselves. So notified case is passive, hidden case is active, and if you mix them together, active plus passive, then it will be sentinel surveillance. So sentinel surveillance is for all cases, active for hidden, passive for notified. So what is correct for sentinel? True for sentinel surveillance they are asking. True for sentinel surveillance. So true is that it include notifiable case. It include notifiable, it also include hidden case. Both together is sentinel. Sentinel surveillance is something which we do in HIV also. And when we do sentinel surveillance in HIV, our purpose is to know the trend of HIV, whether HIV is increasing or decreasing in country or not. And in the sentinel surveillance for HIV, sex clinic attendant are not coming in that survey. Sex clinic attendant are not included in HIV sentinel surveillance. So who are included in HIV sentinel surveillance? First is high risk group. Does doctor belong to high risk group for HIV sentinel? Does doctor belong to high risk group for HIV? No. You have not performed that well. Sex worker come under high risk group, then IV drug user, male having sex with male, and transgender. 4 people are high risk group for HIV. Then 2 are bridge population, which are single migratory worker and long distance truck driver. In these people we go and search. These are active surveillance. And finally the 7th group is ANC mother, which come to hospital by themselves. So we do sentinel surveillance in HIV. We search for active in high risk and bridge population, and passive come to hospital by themselves. Okay, and it will tell us the trend of HIV. Like let's say in Bihar last year the HIV is 0.2 and this year it is 0.1. It means in Bihar HIV is decreasing. Okay, so it is telling us trend of HIV. One more thing which come from sentinel surveillance is, if a state is written as moderate prevalence state for HIV, moderate prevalence state means HIV in high risk group like sex worker and all is more than 5%, but HIV in ANC is less than 1%, because sex worker are already living in separate part of the society most of the places. So even if in them it is more than 5%, it's not a thing to be worried that much. But if HIV is more than 1% in normal female, it means HIV has spread in general population. So first we will try to decrease ANC less than 1%. Then we will focus on high risk group. So if ANC is less than 1, high risk group more than 5, that is moderate prevalence, very frequently asked thing. Okay. So do remember about this sentinel surveillance thing. Now, how do we test ANC mother? ANC mother is tested by opt-out testing. And high risk group and bridge population, they are tested by opt-in testing. You understand? Opt-in, opt-out? Let's say suppose I am a transgender, okay? And you came to me. Why you came to me? To test me. So I will first, you will ask for permission कि क्या मैं ले लूं, should I take it, the blood sample, and then I will say कि ले लो, take it. So I will opt in, I will give the permission, then you will test. But in ANC there are, do remember this question has been came in last to last MCI only, कि in ANC and during blood transfusion there are 5 tests which are compulsorily done. What are those 5 tests? One is HIV, second is hepatitis B, third is hepatitis C, fourth is VDRL for syphilis, and fifth is malaria. So in ANC mother, we already do these 5 tests without taking their permission. So only option which ANC mother have is, if they don't want to be tested for any of these like HIV, they can opt out. So now, like if you are not liking my class, you can opt out, but you cannot opt in because you are already watching it. So these ANC mother, they are already in the panel of test. They cannot come more in. They are already in. Only thing they can do is, if they don't want to be tested, they can opt out. And if they will opt out, will you forcefully test them? Of course not. So opt-out testing is in ANC mother, and these 5 tests are compulsory in blood transfusion and in ANC time. Okay. Now, in capsular polysaccharide vaccine of meningococci, which subunit is not there? So meningococci vaccine is of strain ACY-W135. So which subunit is not there? B subunit is not there. Along with meningococci, the second polysaccharide vaccine is VI polysaccharide, is also cell wall vaccine, and this VI polysaccharide is for typhoid. Okay. Third is HIB, Haemophilus influenza type B vaccine is also polysaccharide vaccine. Okay, Haemophilus influenza is also, these all are cell wall vaccine or polysaccharide vaccine. Okay, cell wall vaccine are VI polysaccharide, Hib, meningococcal. Okay, and the last polysaccharide vaccine which you should know is pneumococcal conjugate vaccine. And they can ask this question also, that in which group pneumococcal conjugate vaccine is given for sure. Like they will give you a patient is with splenectomy, which vaccine should be given, patient is old age, which vaccine should be given, patient is having sickle cell anemia, which vaccine should be given. So in all these three, sickle cell anemia, old age, post-splenectomy, mostly they die due to pneumonia infection. So all the immunocompromised patient, they must get pneumococcal vaccine. And anyway, pneumococcal is not a live vaccine, so we can give it in immunocompromised condition also. Okay, so these all are for, do remember, pneumococcal, they will create this clinical question. And a post-splenectomy patient, which vaccine is given? Pneumococcal conjugate vaccine. Okay, and first preference is given to sickle cell anemia patient. Okay, due to multiple blood transfusion, they also have compromised immunity. So we give in them this pneumococcal conjugate vaccine. Okay, now next question is about growth chart. In a growth chart, I hope you know, the upper line is 50 percentile for boy. This is the upper line. The second line is for third percentile of girl. Third percentile. And this is at -2 standard deviation or -2 Z score. So this is 50 percentile. This -2 is at third percentile and for girl. Because boys have more weight, so upper cutoff is for boy. Girl have less weight, so lower cutoff is for girl. And if any child is in between this child is normal. Okay. So if someone has weight for height -1.7, -1.7 means this is in between 50 percentile and -2. This means this child is normal. At least you cannot say that this child has low weight for height. If the weight for height is 1.7, I hope you all know low weight for height indicate acute malnutrition. हाइट लंबी है, अभी डिप्रेशन से, ब्रेकअप से या डायरिया से वजन कम हो गया है. हाइट इज गुड, ड्यू टू सम डायरिया, इन्फेक्शन और ब्रेकअप द वेट हैज रिड्यूस्ड. लो वेट फॉर हाइट इंडिकेट acute malnutrition. And because it is 1.7, 1.7 means weight for height is normal and there is no acute malnutrition. So if you found weight for height written 1.7, acute malnutrition is gone because it is in this part normal, and we call this part as road to health. If any child weight is plotted here, it means he is healthy. Then the question they ask is, what will you call the part which is between second and third line? We call them moderate malnutrition. And what is below them? We call it severe malnutrition. Okay, and I hope you all know severe acute malnutrition, SAM, have mid-arm circumference less than 11.5 centimeter. They have visible wasting and edema, and their weight for height is less than -3 standard deviation. Okay, so these three are the criteria for severe acute malnutrition. And if the mid-arm circumference is less than 11.5, it will come red color in Sakri tape. So do remember this. So which two is the growth chart? 50 percentile and third percentile for girl. Then disease elimination will be done by which of the following? Can you answer this question? How do we डॉक्टर पेंटावैलेंट कह रहा है बहुत क्यूट लग रहे हो सर, एज ए ट्रांसजेंडर और एज ए नॉर्मल पर्सन. पेंटावैलेंट, यू आर फ्लर्टिंग विथ मी इन मेनी सेशन है. डोंट फ्लर्ट विथ मी, आई विल किस यू. ओके, आई एम वेरी डेंजरस पर्सन. ओके, सो डिजीज इलिमिनेशन विच विल हेल्प ना, See, isolation and quarantine, they will help in controlling the disease infection. But herd immunity help in its elimination. Like if you give measles to 95% people, remaining 5% people will be prevented by herd immunity. Herd immunity means the immunity which is given by the group of people living around you. If they are immunized, then remaining 5% will also be immunized. 95% vaccinated for measles, then measles will be eliminated. Remaining 5%, even if they are not vaccinated, they will not acquire measles due to the immunity of the group. And do remember, this herd immunity is applied only in case of disease transmitted by fecal-oral or respiratory route. In tetanus and rabies, this herd immunity is not applicable. Now, let's say I am in a group of people where pentavalent is there with me, and we are not dating, but suppose pentavalent is there, or suppose mentis is there, flag is there, some 3-4 people are there, and dog came and bite in my bum. So even if pentavalent and another friend around me are vaccinated, it doesn't matter. I am not protected by their immunity. So why tetanus and rabies herd immunity is not applicable or available? Because in case of tetanus and rabies, the disease is not transmitted by fecal-oral or respiratory route. But in case of measles, if 95% vaccinated, rest will be protected by herd immunity. Okay. Chalo, coming to next question. Best indicator for growth measurement is always growth charting. And in India, the WHO growth chart is based on multi-century growth research study, which is done on children from 6 countries, including India. Why growth charting is best? Because it do not tell only about current situation. It tells a complete picture starting from past till future. So that's why it is best indicator. Okay. Now, one more thing is in Anganwadi, up to which age growth charting is done and which type of growth charting is there in Anganwadi. In Anganwadi, we do wait for age growth charting. And it is done till 6 years. Why wait for age? Because wait for age, it tells about both type of malnutrition, acute and or chronic malnutrition. Are you understanding it or not? Suppose I am a malnourished child until 6 years. Coming to the next question. The next question is about this instrument. It looks like a rocket which will go in someone Asman. So this is Asman psychrometer. They have in the past they have asked about sling psychrometer. This is Asman psychrometer. And whenever the psychro word is there, psychro simply means humidity. So Asman will also measure relative humidity. If you look at my name, that is also Ashwani. That's there. Cooling power of air and air velocity, both of them are being detected by kata thermometer, which will look long. Kata laga and it will be long. But if it is oval or circular, we call it globe thermometer, and globe thermometer measure radiation temperature. Okay, radiation temperature. This sling psychrometer, which came in exam, looks like this, which has wet bulb and dry bulb thermometer. And because it is, why they call it sling psychrometer? Because it will rotate in the room like sling, up, down, up, down. So it's sling movement which is there, and psychro word is there, so that will also measure humidity. Okay, so these are the 4 instruments they asked. Do remember them? In a 16-month-old child, Nikhil, isko live kar dena. 16-month-old child, weight is 7 kg, had bite on a spot. What is the vitamin A that you will give to the child? Do remember, whatever is the age, if the weight is less than 8 kg, then we give 1 lakh. And for treatment, we give it on 3 dose 0114. But if weight is less than 8 kg, then we give only 1 lakh on this 3. If age is less than 6 months, then we give 50,000 international unit of vitamin A. If age is less than 1 year or less than 8 kg, any one of these is there, then we give 1 lakh international unit of vitamin A, and then 2 lakh international unit of vitamin A is given every 6 months till 5 years of age. So that's the treatment. Now, a lot of time they give the image of this child with swollen neck and people think it's mum. No, this is the bull's neck of diphtheria. Bull's neck of diphtheria. In mumps, the swelling will be on one side. In diphtheria, bull's neck, it will be both sides. I don't have bull's neck, and it's just double, triple chin, but bull neck will be swelling here. Okay? And of course, in diphtheria, you will also find this pseudomembrane. This pseudomembrane has 2 characteristics which has been asked. First of all, it has clear margin, and second, it bleed when we try to remove it. So they have asked the quarantine period of diphtheria, and quarantine is done on people who are healthy, suspected of carrying infection. Quarantine is done for incubation period. And in case of diphtheria, the incubation period is 2 to 6 days. And that's option D. So that is diphtheria image. Again and again in micro, PSM, PITS, they all ask it. Again, PSC, child running nose is there, and rashes started from face and then went to other part. So this will be measles. Chicken pox will be coming out, and there will be no runny nose on chicken pox. Next question is, they are asking ratio of incidence in exposed to incidence in non-exposed. So when they say ratio means it is one above another, and this is the formula for relative risk. If they say attributable risk, they will say incidence in exposed minus incidence in non-exposed by incidence in exposed multiplied by 100. That is attributable risk. And if it is population attributable risk, then wherever we are writing expose, in place of expose, we will replace by population, and the formula will become of PAAR. So in population attributable risk, it is population minus incidence in non-exposed by incidence in population into 100. Do revise this formula, and do remember, if they say ratio or by, incidence in exposed by incidence in non-exposed, that is relative risk. Which of the following site is not used for measurement of skin fold thickness? First tell me, skin fold thickness is bigger in male or bigger in female? So answer is skin fold thickness is bigger in, किसकी चमड़ी मोटी है, male or female? Tell me. I am waiting for this answer. Is it bigger in male or bigger in female? Okay. So when we measure skin fold thickness, mid triceps area is the best site to measure skin fold thickness. Second is we measure it on suprailiac, then we measure it on biceps, and then we measure it on subscapular area. So these are the 4 areas where we measure it, and then we take the average. If average of 4 sites is more than 40 mm in male or more than 50 mm in female, then we say obesity. So you can see it is 10 mm bigger in female. Kiski chamdi moti hai? Who have bigger skin fold thickness? That's female. And I don't answer it by looking at me, or you will think male with hippopotamus skin and you will answer male. It is bigger in female, and it is measured by which instrument? It is measured by Herpenden caliper. So see, in the name itself there is her pendant caliper. Okay, and why it is bigger in female? Because female have subcutaneous layer of fat below their skin. That's why female skin is soft to touch. And होती है कि नहीं soft touch में? And it's there ना. I was telling it in one of the class, and a student sitting in second row, he started touching the girl next to him and said, "Yes, sir, it is soft." I said, "No, you cannot tell it by touching. You have to pinch to know the answer." And because in her pendant, we pinch at this foresight and then know the answer. One more thing they ask is about waist circumference. Which has bigger waist circumference, male or female? The answer is male. And a male has bigger waist circumference. If it is more than 102 centimeter in male, or in female if it is more than 88 centimeter, then we call obesity. है ना, male का कमर बड़ा है. Okay, but if they say waist to hip circumference ratio, in which it will be bigger? Because waist is bigger in male, so this waist to hip circumference ratio is also bigger in male. Okay, and they have asked it that what is the waist to hip ratio in female which indicate obesity? More than 0.85 indicate obesity. So do remember this part at least, that in female it need to be more than 0.85 to call it obesity. So whenever they ask about waist, remember me, male with bigger waist. Okay, and in female waist to hip is more than 0.85 obesity. This image is of which disease? Can you guess it? You can see some pinpoint petechial rashes. This is of dengue. And then dengue, during recovery of dengue, you can see a special type of patch in dengue, that is island of white in sea of red. Lal Sagar mein safed tapu, in Red Sea white island like drops will be there, more ecchymosis will be there. That is during recovery of dengue. So special type of rashes are there. Now broken vaccine vial will be discarded in which color? See, if it is broken cytotoxic drug vial, then cytotoxic drug vial will go in yellow, but simple vaccine vial will go in blue. Similarly, they can ask, where will you throw the plastic wrapper of syringe? So plastic wrapper of syringe is without any contact with blood. It is just a garbage. It will go in black along with other garbage. Black is not for biomedical waste. If they ask, where will you throw culture plate? Can you answer this question? Where will you throw the culture plate? So culture plate and culture medium, both are microbiological waste, that goes in yellow. Okay. Where will you throw the cotton? That will also go in yellow. Where will you throw the blood bag? That will also go in yellow. Where will you throw the acrylic gloves or contaminated gloves? So no matter which gloves they are talking about, all gloves goes in red. Where will you throw the PPE kit? The original PPE kit is also made up of plastic, so that will also goes in red. Okay, where will you throw needle with fixed syringe? So needle with fixed syringe will go in white. White is for four things: needle, blade, scalpel, and needle with fixed syringe. So they all go in white. If you want to throw something other than that, please let me know and we will discuss it. Now, in this image, there is a diagram and they are asking which point is onset of symptom. Onset of symptom start at which point? Very good. A lot of my friends are actively answering, and in spite of the hindrance, you are still there. I love you for that. Thank you so much. So, which point is onset or starting of symptom? You can see when this is A is the point when the pathogen entered. So A is the point of entry of pathogen. B is subclinical disease, that means there is no symptom yet came, and the disease pathological change is occurring at B. So B have some pathological changes which are occurring at B. pathological change. At C, there is onset of symptoms. So onset of symptom is at C. And at this point D, when clinical disease start, this is the point D when we do diagnostic test. So we can do the test at D. Okay. So do remember this pointing question, which has been asked in all the exam platform already. Now, microspora faini, does it cause bagasosis, farmer lung, bicyanosis, silicosis? So micropolyspora faini is for farmer lung. For bagasosis, the causative organism is thermoactinomycetes sacchari, but they will only give thermoactinomycetes as the option. Bicyanosis occur in textile or cotton factory worker, and this bagasosis, it not just only in sugarcane mill worker, but along with sugarcane, it also occur in cardboard factory worker. Both of them will have it. And silicosis is the most common respiratory occupational disease which will occur. And silicosis patients should have annual screen for TB, because in silicosis their lung is damaged by silica, so now TB bacteria can easily grow in their lung, therefore they should be annually screened for it. Okay, very important area for your exam. In disaster management, all are true except. So I hope you know the cycle of disaster management. First there is impact, then we start doing response and relief, in which we will also do the triage and treat. After response, we try to make them self-dependent by giving them their job back, rehabilitation. And after their job, then we can construct their houses. And then we do mitigation. Mitigation means decreasing impact of future disaster. A very good example is trying to make earthquake-proof houses will decrease the effect of future earthquake. Okay, so or planting tree will also be mitigation. After mitigation, there is preparedness, and whether you are prepared or not, there is next impact. So this three event can together also be called as recovery. So we can say impact, recovery, mitigation, but better is response, rehabilitation, reconstruction. Remember it. So to remember it, we can use the mnemonic triple R. Suppose after having that movie Triple R, they went to MP, Ujjain, and in Ujjain, when you come out, there is this marijuana bhang shop also. So they had it, and after that, of course, there will be impact. So triple R, MP, impact is the cycle of event. It will start with impact, then triple R, then MP, and impact, then triple R, then MP. So which is not true, except they are asking. Mitigation is before a disaster strike. Yes, correct. We do mitigation before the impact. Response is in pre-disaster phase. No. Response is taken only when there is disaster, then we have to take the response now. So this is wrong. Yellow color is for medium priority. Yes, we can say. And they have asked it also, which is for relatively stable patient. And people thought relatively stable is green. No, relatively stable is yellow, who needs surgery in 6 to 24 hours. Green are completely stable. Green are for stable ambulatory patient, which cannot run like ambulance, but at least they can be shifted from one place to another on wheelchair and all. That's why they are ambulatory. And we all know that last priority black is for dead or moribund patient who are certain to die. But if it is a war situation, in war we do reverse triage, and when we do reverse triage, the first priority goes to green, because if any soldier come with minor injury, we will first try to heal them and send him back to fight. Go fight, come with major injury, like that. So green is the first. Then second will be, of course, yellow, then red. We never give priority to black because they are anyway dead, so no need to give priority to them. In disaster management, following our practice except. We do triage, we do rehabilitation, but mass vaccination is never allowed or never done for disaster. And we already have discussed that tetanus, typhoid, cholera, only 3 vaccine are given to healthcare worker. No vaccine for mass vaccination is there. Okay. Now, next question is, if they ask about maternal mortality ratio, on which 2-3 numerical also come. Maternal mortality ratio is maternal death per 1 lakh live birth. It is not per 1 lakh female, per 1 lakh live birth. And maternal mortality ratio is taken in the period when mother is pregnant plus 6 weeks after delivery. And we, in the MMR thing, we write the maternal death in this period due to delivery related cause only. So if some mother died due to, let's say I am a mother and after delivery I put my hand in socket and I died due to electric shock, that will not be maternal death. Or if I died due to drowning, that will not be maternal death. And it is divided by live birth multiplied by 1 lakh. So that's why it is ratio, because in ratio numerator is not a part of denominator and mother is not coming from live birth. So that's why it's a ratio. Do remember, in sustainable development goal, the 3 target are 70, 12, 25, 70, 12, 25. 70 is for maternal mortality ratio, 12 is for neonatal death, and 25 is for under 5 mortality rate. Under 5, 25. Neonatal 12, 70 MMR. Remember, IMR not a target in SDG, as well as when we take global hunger index. In global hunger index also, infant mortality rate is not a target. So what are the target in global hunger index? First is under 5 mortality. Then in global hunger index, we have the target of undernourished children. Then we have the third target of stunted, wasted, or low weight for aged children, and stunted, wasted children. Okay, so that these 3 target we take, but not infant mortality rate. Disease shown in this image is, what is this image? This is the image of phrynoderma, which occur in US, UK when you are in zero fat diet. So essential fatty acid deficiency lead to phrynoderma, rough toad like skin occur in that. Niacin deficiency will have of course lead to pellagra with 4D, the diarrhea, dermatitis, dementia and death. And niacin will have necklace like castle neck appearance. You know, this is castle neck appearance of lesion will be there. Okay, castle neck appearance lesion will be there. Around the neck there will be brownish discoloration like a necklace. Okay, so that you can easily identify. When we want to monitor air pollution, one thing for sure is sulfur dioxide, because this is the best chemical indicator. It should always be there when we are measuring air pollution. Particulate matter then we use, and based on particulate matter we classify the air quality into 4 categories. If the air quality index or particulate matter is less than 50, we will say good quality air. Achhi hawa chodi. If it is 51 to 100, we call it Satiswa ka factory, Satish factory air pollution. And if it is MPVS is the way to remember remaining part, 101 to 200, we call it moderate quality air. If it is 201 to 300, we call it poor. If it is 301 to 400, we call it very poor. And if it is anything more than 400, we call it severe. Today only a student has asked me the question, sir, what is very severe? There is nothing like very severe. More than 400 is severe. So the mnemonic is MPVS, moderate, poor, very poor, severe. In NEET exam, they have asked if the air quality index is 473, where will you put it? So 473 will also be severe. Anything more than 400 is severe. Okay. So the correct answer here is 4, because in this where we have both sulfur dioxide and particulate matter. So best chemical indicator is SO2, but if they ask best biological indicator, that lichen. And they ask again and again that what is swelling index? Swelling index, does it measure soil pollution, air pollution, or both? So swelling index only measure air pollution. We keep the cloth which may absorb the dust particle and tell us how much is the air pollution. Swelling index do not talk about soil pollution, only talk about air pollution. Which of the following regimen would you advise for mass prophylaxis of anemia? If you are doing mass prophylaxis, giving only iron is not good. We have to give vitamin C, folate, vitamin B12, everything. Okay. Most common cause of vitamin B12 deficiency is alcoholism. Other than that, there is veg diet which can also cause it. Hypothyroidism can also cause it. But most common is alcohol. Then do remember, iron tablet is always given with citrus fruit. It helps in absorption and it is never given with milk or tea or anything like that. So we give B. Which of the following is statement regarding Factory Act is correct? Child less than 21 years cannot be employed in dangerous work. No, no, no. This limit is between 15 to 19 years cannot be employed in dangerous work. Child age less than 19 cannot be employed. No, this age limit is 14. Below 14 years we are not allowed to work. Maximum working hours should be 48. This is correct. So remember, maximum working hour is 48. But if they say maximum work hour including overtime, so overtime we can do maximum 2 hours per day for 6 days, 12 hours. So 48 plus 12, 60 hours is maximum working hour including overtime per week. But if they say maximum work hour per day, for per day maximum work hour is 9 hours written in PAAR, that it include 1 hour of break. Okay, so remember, no child below 14 years can work. 15 to 19 can work only between 6 a.m. to 7 p.m. for a maximum of 5 hours per day in non-dangerous condition. Okay, after getting fitness from surgeon, because they will lifting some weight, so the surgeon will check for hernia and then give physical fitness. One of the following is not a characteristic of causal association. Causal association means natural history of disease. How does a disease start and then go ahead? This is also known as cause precede effect. Natural history means cause precede effect. They have asked it. It also means temporal association. Like my younger sister Mona used to do a lot of scooty accident. So they ask, how would you know the reason of accident if you want to know the reality? Best way is to sit in the scooty, but that can be life threatening. So second thing is you can follow someone and know the real reason. So to know the natural history or causal effect or temporal association, best study is cohort. Okay. A lot of time they ask which study is best to know natural history. People think case control because it is history. No. Natural history is best depicted by cohort, because in cohort only we do follow up. Whenever follow up study come, it's cohort. And this temporal association, there was a scientist Hill who give criteria of association. So in Hill criteria of association, temporal association is being taken as most important criteria, because through temporal association we can know the reality. Like in case of my younger sister, when I sat on her scooty because there was no other scooty to follow, then I found that her hand is small and brake is loose, so she is unable to catch brake and doing accident again and again. So to know the reality, you have to do the follow-up, which is there. So Hill said about 9 factors which can tell about causation. But in those 9 factors, sensitivity was not a factor. And there is coherence, specificity, biological plausibility, but not sensitivity. Okay. Now, the method of choice for purification of highly polluted water is, rather than putting chlorine slowly and slowly, we will put chlorine too much and then we will gradually dechlorinate it. So superchlorination and dechlorination is for highly polluted water. Do remember, whenever you are in camp thing, in them the best way of disposal is deep trench. And if there is 10,000 population, we will dig 1 acre land and we will ask them ki hago, and we will ask them to defecate in that. Deep trench latrine is best for the camp. Okay. Now, Horrocks apparatus. This Horrocks apparatus is used to know that how much bleaching powder you will put in water that will kill all the bacteria? How much bleaching powder is needed to kill bacteria of water? Okay, so this means this Horrocks apparatus is trying to tell us how much chlorine water is demanding to kill the bacteria. So Horrocks apparatus tells us chlorine demand or amount of bleaching powder. And for that, in Horrocks apparatus, there is 6 white tubes, and along with that by white tubes, there is an indicator which is blue color starch iodine. So which indicator is used here? Starch iodine. So let's say you are in a flood affected area or cholera affected area. First thing you will do is you will detect the chlorine demand. After detecting chlorine demand, you will put that bleaching powder and you will let that bleaching powder kill the bacteria. This is known as contact period. So we give around 1 hour time in which bleaching powder will release different ion and will kill the bacteria. But they ask what is the most important ion of bleaching powder? That is HOCl minus or hypochlorous ion. The one with rus. Rus means juice. The one with juice or rus 1 minus will kill maximum bacteria. It has 80 to 85% killing action. So mainly they kill it. After the killing action occur, then we again take a sample of water, and in the third step we try to detect how much chlorine is left in the water, how much is the residual chlorine, and this residual chlorine is detected by chloroscope. In the chloroscope there are 2 type of tests, orthotoluidine and orthotoluidine arsenide test, and they ask this orthotoluidine test, does it detect free chlorine or combined chlorine? So whether it's orthotoluidine or orthotoluidine arsenide, both detect both free and combined chlorine. So what is the difference? The difference is that orthotoluidine detect them together and orthotoluidine arsenide detect them separately. So the better test is orthotoluidine arsenide. One more reason is orthotoluidine arsenide is not affected by nitrite and other ion impurity. So both detect both free and combined chlorine. Do remember, these are the 3 steps in which we do chlorination. Now next question is, a patient has cough with sputum but his ZN smear negative. You did X-ray and X-ray suggested that patient has TB. What is the next thing you will do in RNTCP or National TB Elimination Program? After ZN smear came negative, which thing you will do? Culture, line probe, nucleic acid amplification, or what? The answer is we will do CBNAT. CBNAT is cartridge based nucleic acid amplification test, and it is done by polymerase chain reaction. Sometimes it is also known as gene expert. So this CBNAT test is the first test in 5 type of patient: HIV patient, diabetes patient, COVID patient, those who are already taken the treatment of TB in the past, previously treated patient, and it is also the first test for pediatric TB suspect. Because you know the children ना, if बोलोगे कि थूक दो तो मुद देगा, बोलोगे मुद दो तो थूक देगा. It's very difficult to collect sample in pediatric patient because you will ask them to spit, they will urinate, they will spit. So in these 5 we can't waste the sample, and their immunity is usually low. So the first test which we will do in them is directly CBNAT. For rest other people, if you want to do screening of TB in the population for screening of cases, best is ZN smear. And culture in liquid medium, this is the gold standard for TB diagnosis. This is best test for TB diagnosis. Culture in liquid medium, gold standard for TB. Because CBNAT sometimes can overdiagnose, but culture will give colony characteristic and will not overdiagnose. So that's the best test. Now, they can ask which are major of dispersion, which are major of central tendency. So mean, median, mode, these 3 only tell about central tendency, what is in the center of the data. Standard deviation, range, variance, standard error, and mean deviation. These five things tell about this person कि how much spread is the data, रायता कितना फैला है, how much spread is the data or curd that dispersion, not the data only. The data dispersion is told by five things, central tendency by three things. So which are measure of dispersion? 1 and 2 only. Standard deviation, range. Okay, and this is known as descriptive statistics. All this central tendency and except standard error, all these things tell about whether the data is to the point or dispersed. So it is descriptive statistics, which is told by central tendency and dispersion. But confidence interval and standard error tells about inferential statistics. Inferential statistics means we will we will collect the data from a sample and we will apply it on the whole population. Does it make sense? What is inferential? Let's say I want to know how much affair you had in last 5 years of MBBS. So rather than asking it from all of you, I will ask it from any three randomly selected from the class, and I will say this much affair occur in everyone in the class. So I am taking it from 3 people and telling it on the whole class. This is the role of confidence interval and standard error. That's why they are inferential statistics. Okay, do remember, it's an important PYQ. The researcher undertakes follow-up study for certain time period, cohort study. And because it's a cohort study, so we can find incidence here, relative risk AR, PAR. Now it is telling that people develop disease with time. If it is with time word there, it's incidence rate. We have already discussed the formula above also. That's incidence rate. Now, longitudinal, observational, and analytic study. First of all, longitudinal or follow-up or prospective, these are the word for cohort, so you can answer it directly. Second thing is, when it comes to study, interventional study are all kind of RCT. And when it is observational study can be done to describe the data, or it can be used to analyze the data. In analytic study, there is case control and cohort. And in descriptive study, if it is done on one patient, that is case report, we call it care study also. One patient. But if it is done on one or more than one group of patients having common illness, we call it case series. So these are descriptive analytic. But two study come in both category. They are cross-sectional and ecological. Because cross-sectional and ecological also give us data. So with that data, we can describe the condition or we can analyze the condition as well. So you can see it here itself. Cohort is under observational and analytic both. So observational, analytical, longitudinal will be cohort study. Now, incorrectly rejecting null hypothesis when it is true. What is that? See, type 1 error is known as alpha error. And alpha error or type 1 error means false positive. Simple. And this is the meaning of p-value also. So many questions on p-value, alpha error can be done by this concept that alpha error, p-value is when you are acting over smartly, when you are saying non-significant as significant, result as significant. And a very good example is coronal study by Baba Ramdev researcher. In the trial they said we had given the medicine on only those people who are without fever, and then the result said that it can treat corona fever. So it means it was a non-significant study which were forcefully said, because when you are giving it on people without fever, how can you say that it can treat fever? So this is false positive. Type 2 error is when you underestimate yourself, do false negative mistake, that is beta error, type 2 error. and it is just opposite of alpha, saying significant as non-significant. So let's understand this with a good example. Suppose from your batch, Dr. Mantis came to me and put a steth on my abdomen, and because Dr. Mantis want a party from me, so he said, "Congratulations, you are pregnant," to me. So which type of report he is giving for my pregnancy? False positive. In my case, actually there is no pregnancy. I sapat makasam, I am not pregnant. So in reality, my abdomen is null. Lul. There is nothing significant in my abdomen. In reality, null hypothesis is correct. I am not pregnant. It is null. But what Dr. Mantis did, null hypothesis is correct. But the scientist or Dr. Mantis rejected null hypothesis and forcefully said that you are pregnant. So he is incorrectly rejecting null hypothesis now. Actually, null hypothesis is correct. I am not pregnant, but he forcefully rejected it. Forcefully said my non-significant abdomen as significant. So which error he is doing? Dr. Mantis is doing alpha error, type 1 error. So incorrectly rejecting null hypothesis is alpha error. Alpha error or p-value means false positive. Okay. Now, more false positive if it occur in a case, the test will become more sensitive. More false positive, more sensitive. Because sensitivity is ability to include. The more people is included, the more sensitive the test become. And sometimes the people who are included are not actually having the disease, they are false positive. Let me explain it with an example why I am saying that sensitivity is directly proportional to false positive. Suppose, and I wish that this should happen, suppose they lower the cutoff for MCI exam from 50% to 20%. So if they lower the cutoff, more people will pass, so sensitivity will increase. And now those students will also pass who have just studied, let's say, medicine, surgery, obs-gynae, 3 subjects, they can also pass. So many of those will pass who have not studied but still came positive. That means many of the people who without study, they will also pass. False positive will also be more. So whenever we include more people, sensitivity increases, but many of them are false positive. Many of them has not studied, they will also pass. So that is there, it will become more sensitive, more false positive, more sensitive. Now, lead time. What is lead time? Lead time is the time between a screening test to usual diagnosis. This is lead time. And in MCI exam, August 2020, they gave a picture of this type of thing. They point 5 thing, A, B, C, D, E. A is the entry, B is the time of screening test or early diagnosis, C is critical point, D is diagnostic test, and E is the point of death. So they ask, what does BC represent in this curve? See, between A to B, B is the point of earliest detection. We cannot detect before B. So A to B disease is hidden. This is latent period. Now, critical point is that point after which cancer is spread. So if you are going to screen for cancer, you have to do the screening between B to C. So this B to C is the screening time, okay, in which diagnosis should be made. And what is lead time? Lead time is the gap between screening test and diagnostic test. This B to D, complete B to D, screening test to diagnostic test, this gap is lead time. So B to D is lead time. That was answer 2. Okay. And whenever we do the screening test before spread of cancer, then lead time is useful. There is no lead time bias. Okay. Chalo. Now, a study was done to assess malnutrition among young children. Children were selected from rural urban area out of these 30 among rural and 20 among urban were found to be malnourished. Which test you will apply? See, here the data is categorical. Categorical, there are two data. One is urban rural, but in urban rural we are comparing you are malnourished or not malnourished. So this type of data is not measurable, it's just categorical. Categorical is qualitative data. And whenever it is qualitative or categorical data in more than or two group, we will apply chi-square test. And do remember this point that all the disease data like hypertension, diabetes, anemia, if I say obesity, obesity is quantity or quality? You can say I am obese, but you cannot say that, sir, you are 9.8 obese. And you can only say कि you are mild, moderate, severe. है ना, थोड़ा मोटा है, बहुत मोटा है, फटेगा. है ना, you can only categorize my obesity. So all disease are categorical, or median and mode are categorical, and data which are in percentage or proportion, these are categorical. So if you found anything like this in the question, any disease, median mode, percentage, proportion, answer will be chi-square test directly. And here also it is chi-square test. But if you found data like cholesterol, which they ask in last MCI, cholesterol is measurable. So cholesterol, HB, BP, weight, blood sugar, all of these are quantitative. And if data is quantitative, measurable, and in the question they have written pre-post word, before giving medicine, after giving medicine, they are comparing data, or match data. In that case, we will apply pair t-test, which is also known as dependent t-test. If there is two group, we will apply unpaired t-test, which is also known as student t-test. And if there is three or more group, we will apply ANOVA. Okay, so let's say I am asking this question कि I am measuring BP of two group of patient before and after giving drug. Answer will be pair t-test. I said I am measuring BP after giving drug in two group of patient, only after two group. BP is measurable, answer will be student t-test. I am measuring BP of three group of patient after giving drug, three group ANOVA. But if I say I am measuring presence or absence of hypertension in two group after giving medicine, so presence or absence is categorical, and there we will apply chi-square test. So like that, they can ask questions from here. Do remember it. This question is in the same color as the backyard, so you cannot read it, but I can read it to you. I have already given this question above. The question is 30,000 women were followed up for 10 years for development of breast cancer. So 30,000 women followed for 10 years for breast cancer. After this, 1,200 women developed cancer and were given questionnaire. So out of this 30,000, 1,200 developed breast cancer and they were given a questionnaire. Now, this questionnaire was to detect which type of risk factor are there. Additionally, 2,000 women and 2,000 women have no cancer. They were also asked to fill a questionnaire. Okay. So, which type of study is done here? Here, this questionnaire will give us written past data. Written data. Questionnaire will give us this written past data. And there is also follow-up. And we have discussed it that if there is follow-up in future and past data is also written data or work record data is there, that means we are going in both direction. That is mixed cohort. And mixed is also known as ambidextrous cohort. That is also known as nested case control. So the correct answer will be nested case control. If future follow-up plus past written data is there, it's nested case control. But if, like, let's say they give this question that urinary bladder cancer is 1.8 times more common in staff in labors of dye industry, है ना? In labors of dye industry as compared to office staff. Okay, as compared to office staff, 10 times more common, 1.8 times more common in labors of dye industry. Okay, based on 10-year work data. So this part is which type of study? Option A, is it case control study? Is my voice coming properly? Yeah. Is it case control study? Is it retrospective cohort? Is it prospective cohort? Or is it nested case control? What is your answer? Chalo, my dear friend, please do reply. I want to know your answer for this question. Very good. Dr. Mantis was correct. Achha, you can read that question also. Very good. Then it was okay. So do answer this question. What is this? Case control, retrospective cohort, prospective cohort, or nested case control? What will you answer it? Dr. Flag is saying B, 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 B. Very good, Dr. Flag. You raised the flag correctly. Only work record data is there. No personal history. Because in case control, there will be taken personal history from case and control. In prospective, we will do follow-up, and there is no follow-up is here. In nested case control, there is follow-up plus written data, but there is only written data. So the correct answer is retrospective cohort, and this is the expected question which I am expecting in July paper. Retrospective cohort will come. Okay, very good that you answered. Now, who transmit Quinnipiac fever? Air transmit Q fever. But Quinnipiac fever is the other name of French fever. Why we call it Quinnipiac fever? Because it is caused by Bartonella quintana, trench fever. And who transmit trench fever? Can you tell me who transmit trench fever? Remember the mnemonic PUT. Pediculosis, epidemic typhus, relapsing fever, trench fever. So trench fever is by louse. PUT. So who transmit Quinnipiac fever? Louse. Very good, Dr. Mantis and Sakshi, both are correct. It's not Sakshi Arora. It's only Dr. Sakshi. They both are correct. It's louse, correct. So now let's move ahead. A chest physician took the force effective volume of 200 smoker, and out of this 200 smoker, he found that first quartile, that means 25% people have force effective volume 1.5 liter, and 75% people third quartile. 25% is first quartile. Quartile is 25%, na? So 75% is third quartile. Okay. So he found 25% is at 1.5 liter, 75% is at 4.5 liter, first and third quartile. Question is, how many people are between 1.5 and 4.5 liter? So can you answer it? How many people are between 1.5 and 4.5 liter? So between 1.5 and 4.5, 50% people are there. And what is the 50% of 200? 50% of 200 is 100. So answer will be 100. In the same question, they can ask how many people are less than 1.5 liter. Less than 1.5 liter is 25% of 250. How many are more than 4.5 liter? More than 4.5 liter are 25% of 200, again 50. So between is 100. Answer is 100. Okay, not 50, dear. I hope you all got the trick which is there. They can ask how many are between them. So between are 50%. 50% means 50% of 200. So you have to take the sample size into account and then answer accordingly what they are asking. Okay. Chalo. Now, a study is conducted with 30,000 women where researchers want to know the relationship between C-reactive protein and risk of stroke. And again they are saying that risk of stroke is more when CRP is more. More CRP, more risk of stroke. More MI, more CRP, like that. Okay, coming. So now, which of the four line is correct? What can you say? First, CRP increase lead to MI. Second, increase in CRP decrease MI. Third, increase in CRP increase MI. Fourth, decrease in CRP increase MI. So one thing is, if CRP is increasing, MI is increasing. So they both are increasing together. But it doesn't mean that CRP is causing MI to increase. Lead to or causing. These are a strong word to say. We cannot say like that. We can only say that increase in CRP is causing increase in, is associated with increase in stroke, but is not causing or leading to it. This is the line which Dr. Hill said, that correlation does not imply causation. If two things are happening together, it doesn't mean one is causing the other. Okay, we cannot say lead to or causing. Okay, like for example, in India, vaccination is increasing and COVID cases are coming down. But we know many countries, including US, UK, China, Seychelles and Israel, where more than 95% vaccination was there, still COVID case was, second wave came. So it means vaccination is not causing less case, and it is just correlated. And correlation does not mean causation. Okay. A study is conducted in a population of diastolic blood pressure, mean is 110, standard deviation 11. For vitamin D, standard deviation is 3. What is the relation between two variants? So this question look like complicated, but it's not complicated. We all know standard deviation is under root variance, or variance is standard deviation square. So when we talk about variance of vitamin D standard deviation is 3. So standard deviation is 3, standard deviation square or 3 square, it will come 9. But when we talk about variance of diastolic blood pressure standard deviation is 11. So 11 square 121. So definitely whoever have big standard deviation also have big variance. So variance of diastolic BP is greater than variance of vitamin D. You just have to see where the standard deviation is big. Wherever the standard deviation is big, their variance will also be bigger. So if standard deviation is big, variance is big. Simple. Okay. So standard deviation of diastolic BP is bigger, so variance of diastolic BP is bigger. Okay. So simple. But if they ask coefficient of variance, this coefficient of variance is standard deviation by mean, and then we will have to calculate it differently. Okay, and do remember this coefficient of variance, it tells about two things. Coefficient of variance compare quality of data, and it compare dispersion of data, how much data is spread. These two things are being detected by coefficient of variance. Both are being asked in NEET exam. Compare quality and dispersion of data. Okay. Percentage variation in one variable due to other variable, this is coefficient of determination. Okay. Let's say after the class, you went back to your room partner and you found your room partner is ready with a joint in his hand. Mahal is set. And you have seen it that as the number of joint per day in your room partner has increased to 6 from 1, the marks are decreasing. So there is which type of correlation? Negative correlation. Correlation tells us direction of association. And for this we use correlation coefficient, which can be minus 0.8 here. So coefficient of correlation tells us about how strongly two things are associated. So you can say to your room partner that, see, negative correlation is there and it's a strong association. Do not smoke so much of joint, your marks is decreasing due to it. So your room partner will take another puff, put it on your face, and we say, what are you saying, man? What does it mean? How does it prove? So then you can do R square. And if you will do a square of minus 0.8, it will come 0.64 or 64%. So you can say that, my dear friend, if you decrease your joint, your marks can increase by 64%. This is coefficient of determination R square. And this R square tells us percentage variation, which was in the question they were asking, percentage variation. So how much two things will fluctuate percentage wise? That is coefficient of determination. Okay. Now your room partner will say, don't talk bullshit to me. He will smoke another cloud on your face and say, you are not at my level to talk. Take one puff, then we will talk. And why are you talking in percentage? Tell me directly that if I decrease from 6 to 1 joint, will I pass or not? So if someone wants to tell the exact variation in one variable on changing another, then we use coefficient of regression. Regression will tell us exact variation, because it has a formula y is equal to bx plus c, so it can tell us exact variation. And as I said, coefficient of variation is used to compare quality of data. So these are the 4 coefficients which are used. Do remember their roles. From their role only, theory part only, NEET have asked 2-3 questions. So it is important to revise this question before exam. Okay. Now, woman is traveling from Bihar to Delhi, suspected to have Kala Azar. What is the investigation you will do? RK39 test. And for Kala Azar, Bihar, UP, Jharkhand and West Bengal, these 4 are endemic for Kala Azar, in which Kala Azar case occur again and again. P24 is for HIV and it is better and faster than ELISA. Thin blood smear is, as I said, detect species of Plasmodium, whether it's Vivax or Falciparum. And HRP2, it is histidine-rich protein. This question has came in NEET exam last time, that histidine-rich protein RDT kit, does it detect Falciparum or ovale or both? So histidine-rich protein kit detect only Plasmodium falciparum infection. It does not detect Plasmodium vivax infection. Okay, only falciparum. Now this is a forest plot. I showed you, image based question can come. They are asking how many studies show association. So in this forest plot, this central line which is drawn here, it is at 1, and whenever relative risk is equal to 1 or odds ratio is equal to 1, 1 means no association. If relative risk is less than 1, it means protective or negative association. Okay, like when we talk about drinking green tea and heart attack, more green tea you will drink, less heart attack will be there. So protective or negative will come if relative risk is, let's say, with green tea and heart attack, relative risk is 0.85. 0.85 means more green tea, less heart attack. But whenever relative risk is 1, 1 means no association. So in this forest plot, all the lines which are crossing this 1, they are not showing any association. Like you can see, line 1 is crossing, so no association. 2 is crossing, no association. 3 is crossing, no association. 4 is crossing, no association. 5 is crossing, no association. This one study is not crossing line 1. So only one study is showing association, rest all are crossing, so no association. And this final diamond structure, this is the total of all study. So in forest plot, it is drawn, forest and funnel plot are drawn in meta-analysis. So with the help of this forest plot, we can simply know that if there are 10 studies done on any one topic, out of 10, how many are useful? The one which is not touching central line is useful. So how many are showing association? Only one, which I circled, only that study. So like that, image-based question can come and you can answer. Now, in Anemia Mukt Bharat, pregnant female have HB equal to 9. What should be the treatment? Can you answer it? See, first thing, we never give 100 milligram tablet is obsolete. Now we only give 60 milligram. It is pregnant female with HB9 means she is anemic. When we are giving treatment, then we give 60 milligram elemental iron twice a day for treatment. Once a day red tablet is given for prevention. If her hemoglobin is more than 13, then we give once a day. And once a week red tablet is given in adult female, but not in pregnant. For prevention in pregnancy and lactation, we give tablet once a day. So once a day is for prevention, adult female once a week, and twice a day is the treatment. So correct answer is D. Okay. So very good. Salman Yusuf, thank you for replying. And Huma Tabassum also replied, very good. Which of the following national program includes celebration of Village Nutrition Day once a month? Answer is JSY. In JSY, not only this Village Nutrition Day celebration come, this is the first thing, Nutrition Day celebration. Second thing is they give money to mother and Asa Usa for delivery. Third thing is safe abortion services, which is done in JSY. Fourth thing in JSY is Vande Mataram scheme, in which private doctors are being asked to put logo on their OPD and they will get free iron calcium tablet, OCP and condom to distribute among the patients. Fifth is maternal death review. If any mother die, they will go to the house and neighbor house and they will ask the reason of house. This is known as verbal autopsy. Just by asking, they will find out the reason. And last thing under JSY is maternal tracking. And of course, this tracking is done by Anmol software. This Anmol is green color mother child, and logo is with green color mother child, and it is a tablet based software for tracking. Okay, given to ANM. That's why it is Anmol, ANM online. Okay. So these are the some of the logo where mother and child are together. If they give you black color mother child, Laksh is for improvement of facility in labor room and maternity ward. Okay. This white color mother, white color child is baby friendly hospital initiative, which don't focus on prevention. Its main target is early breastfeeding, early discharge, and breastfeeding on demand. This logo with incomplete mother child is Pradhan Mantri Matru Vandana Yojana, because this program itself is incomplete, not implemented anywhere. And in this program, 6,000 rupees is given nowadays. It was previously 5,000, now it is 6,000. 2,000 at 12 week when mother come for first visit, next 2,000 at 6-month period of gestation, and last 2,000 at 6 week after delivery. Okay. If you found yellow color mother, yellow color child, it's due to susu, yellow color susu, urine. So this is Janani Sishu Suraksha Yojana, JSSY, yellow color mother, yellow color child, in which we give free ambulance, free treatment investigation, and free food. 3 days for normal, 7 days for C-section. If you found blue color mother child, it is UNICEF. If you found green color mother child, that is Anmol ANM software tablet based. This is the logo of Skill India, Kausal Bharat. You can see a screwdriver and a pen both in the logo, so that if you don't get a job by pen, use a screwdriver. And under this Skill India, government is giving low cost, low interest loan, and government is giving training to start business. Okay, so these are the two things under Skill India. Okay, chalo. Now, under National Health Mission, which committee make plan for village health? That is VHSNC, Village Health Sanitation Nutrition Committee, which make plan for village health. In village of remote rural area, listen this question carefully. With poverty, people are only eating rice pulses. Many people presented with clumsiness, stiff and awkward movement, memory loss, irritability, apathy, and confusion. Which of the following is given to prevent and decrease this symptom? So this symptom is suggestive of which disease? Can you tell me the disease? Which disease we are talking about? If they say cross leg walking on toe, then they are talking about neurolethyrism. And neurolethyrism is due to poison boa, and it is treated by vitamin C. But here I am not saying cross leg walking on toe. So what is the answer? If they are framing a question of vitamin B1, they will say people are eating polished rice and there is pitting edema on leg, and along with pitting edema there is dyspnea and congestive heart failure. And which enzyme will be deficient? Thymine transketolase enzyme will be deficient. But they are not talking about polished rice, so vitamin B1 is also gone. Here they are having subacute combined degeneration, which is being treated by giving vitamin B12. So the correct answer is vitamin B12, dear, which lead to this neurological symptom. If it is vitamin D, in vitamin D, they will give bow leg like thing. Bow leg will be there. Okay, so answer is D. It was a good tricky question. I manipulated the language so that you understand all the four options correctly. Okay, I hope it is clear to you, all these four. Now, estimated average requirement and RDA are two things. Which option is correct if you can identify? Estimated average requirement is for 50% and RDA is for 97.5% population. C is correct. Now, which of the following is done before pasteurization? That is methylene blue test. Methylene blue test detect raw milk quality, whether raw milk given is having more bacterial load or less. Rest all tests are done after pasteurization. Then in recent NICT, they asked declaration of Oslo. This declaration of Oslo is for which of the following? T for torture, T for Tokyo. So Tokyo declaration talks about prevention of torture to patient or to animal. International Code of Ethics, this is by Geneva. Okay. Medical termination of pregnancy, that is Oslo Act. And ethical practice in research and human subject, this is Helsinki. This is a new topic being asked in NICT. I am expecting it in your exam. Do revise it. One more thing you can read is Type E declaration, which is regarding human database, biobank and big data. Okay, so T for Tokyo, T for torture. Helsinki is with human treatment, human subject. Oslo, abortion. And Geneva, we all know, is medical ethics and all. Okay, so that's the 5 you should know. Which is not correctly matched. The correct answer they have written, removed. Diagnostic study consort. They mixed this thing. Diagnostic study, the options are being confused. So let me just teach this topic. What happens is, when you are comparing the quality of data in let's say you have some randomized control trial. So consort will have all the RCT under it and will tell us whether RCT are done properly or not. Randomized trial, RCT. Prisma. Prisma will compare all the systematic review done in the world, whether they are being done well or not. Case report will be compared by care study. 1, 2, 3. Then observational study are being compared by moves. Observational study. For diagnostic study, we have starred. In that question, they have wrongly written that diagnostic study by consort. That is wrong. Diagnostic study is not by consort, but diagnostic study by starred. Okay, so just remember this 5 thing. Diagnostic study starred, Prisma systematic review, consort RCT, case report care, observational study moves. Okay. Now, next question is, which is correct for contraction of family? Can you answer this question? It has been asked again and again. What is correct for contraction? So contraction is, there is 2 things, contraction, complete contraction. So contraction is when last child leave home and death of first spouse. This is contraction. Death of first spouse to death of survivor, this is dissolution. Birth of last child to first child leave home, this is complete extension. So usually they ask question from complete extension. Extension word is there, but still child is leaving home. Do remember. Okay. First child leave home and last child leave home. This is the contraction. Correct answer is D. Option A is complete contraction. A is complete contraction. When someone die, that is complete contraction. When first child leave and last child leave, that is contraction. So these 5 stages they ask again and again. That's why I put this in the table here. It starts with formation, marriage to first child. This is the case of my brother Nikhil over here. First child is born, married is there, so he is forming his family. Extension is my stage. Birth of last child has occurred. My wife went through tubectomy, although I could have done through vasectomy also. My wires are anyway hanging down, but with C-section tubectomy is easy, so that is in my stage, extension. Complete extension will occur when our child will leave home, that is complete extension. Then contraction will start when every child will leave. Complete contraction when one of us will die, and dissolution when both will die. Okay, so do remember these phases. They have asked it, they can ask it again. 93 you are replacing with 39. So you are replacing big number with a small. If you replace big with a small, mean will decrease. If you replace small with big, mean will increase. But median always remains same. Median not affected by big number. So that is why if they will give BP like 120, 124, 126, 188, which thing you will use here? You will use median will be the best to use, because there is a big number at the end and median is not affected by big number. Median beech ka hai, it will remain in the center. Okay. Now, a study is conducted. It's a big study in which they took the passenger of Caribbean island. They found them to have some new illness. They also took the same illness in other patient of Pacific island. They admitted them in hospital, write their symptom, how the disease start and all, and then they reported it. So which type of study is here? This is case series. Case series is complete hospital story of one or more than one group of patient having common illness. Okay, so in this story also it is being told that on conclusion it is common illness with a new organism has occurred in two areas. So whenever we are putting two type of patient and we are not giving one group new treatment, one group old treatment, we are just treating them and writing it down how we manage them and all. So this type of thing is case series, hospital story of one or more than one group of patients having common illness. But if it is one patient, we call it case study, one or more one group case series. Okay. Now, high fat diet has a total calorie of 1000 kilocalorie. In this high fat diet, total is 1000 kilocalorie, and out of this 1000 kilocalorie, 50 to 60% is fat. So fat out of 1000, it means 600 kilocalories should be coming from fat, not 800. And if 600 is coming from fat, some will be protein also. So this other options are also wrong. So do remember, high fat diet, 1000 kilocalorie, 50-60% fat. Then, which of the following is method to present health care and disease or problem related to health can be presented by which of the following? So problem related to health is best represented by Ishikawa or fishbone diagram. Let's say I am talking about Indian health system, that Indian health system is not doing well. So in that case, the first reason is that GDP 2.5% is asked by WHO to spend, but we are not giving that 2.5%, we are only giving 1% GDP. That is one reason. Second reason is less rural area hospital, which is causing poor health system of India. So if we want to know the reason for poor health system of India, we can represent it by a fishbone like diagram, which is Ishikawa or fishbone diagram. Okay. Now, a 24-year month has 11 kg was brought to pediatric OPD. Respiratory rate is 38. See, when we call it fast breathing is when less than 2 months is having more than 60 per minute, that's fast breathing. Or 2 months to 1 year have more than 50 per minute, we call it fast breathing. Or more than 1 year have more than 40 per minute, then we call it fast breathing. But here the breathing is 38, that means there is no fast breathing. But chest indrawing was there. Fast breathing or chest indrawing, if there is anything, then we classify this child as having some pneumonia. We classify this as pneumonia. We classify it as severe pneumonia if there is danger sign like cyanosis, convulsions, repeated vomiting, high-grade fever. Those are severe pneumonia. In severe pneumonia, we classify it under pink, give gentamicin, refer. But here it is just pneumonia, and in pneumonia, the drug of choice is oral amoxicillin for 5 days, and then we will ask for follow-up. So this is the guideline for the management. Remember, pink is either stridor or danger sign, and we give gentamicin, refer. And then pneumonia, we just discussed, amoxicillin is the drug of choice. Other than there is cough cold, in which we give home treatment. For snake bite, there is this new logo, do it right, where R stand for reassurance. I does not for incision. I stand for immobilization. After snake bite, we do not let the patient walk. So immobilization is I. G means go to hospital, and T means tell the sequence of event. So that is the thing which you have to do after insect bite. Do it right. RIGHT. These are the thing we do. We never cut incision, and in some movie you must have seen that actor or actress suck the blood from the bite area. Don't do that. That is also not being advised. No cutting, no tourniquet, no sucking of blood is allowed. These all things are not in the guideline. The correct method is do it right, which we discussed. Okay. And this is about vitamin A dosing. Again and again question come from it. So you can go through this page. 50,000 for less than 6 months. If the weight is less than 8 kg or between 6 to 12, we give 1 lakh, more than 12 months and weight more than 8, then we give 2 lakh international unit. Okay. Last question is this box and whisker plot. Which type of plot is there? They can ask positive, negative, skewed. So in a box and whisker plot, This lower part is 25%, upper is 70, and you can see till 25 it is straight, then it is skewed. So this part, the part between 40 to 75, this part is skewed. And you can see skewed part is towards bigger number. And in life, you are going towards bigger number, or your money is increasing. It means which type of deviation you are going? It is, you are positive. So this type of skewed is positive skewed curve. And in positive skewed curve, always remember mean is greatest. So because mean is greatest, we have discussed it also कि median बीच का है. Median will remain in the center. So the sequence will become mean, median, mode. And correct answer will be option A. Now, why this line is very good to remember mean is greatest here? Because if in positive skewed mean is greatest, in negative skewed curve, which one will be greatest? Median can never be the greatest. So in negative skewed curve, it will become mode, then median, then mean. And I was taking this class in Jaipur, where a guy told me a way that, sir, I will tell you to identify this curve in such a way that you will never forget. But you don't tell my name in the class. I said, okay, tell me. He said, sir, take this bar as penis or thought of sex. When the penis or thought of sex is below the belt, under our control, that is the time when we focus on study better and positive, we grow in life, positive skewed curve. But when this bar or penis is in our head all the time, thinking about sex all the time, unable to focus on study, that is the time when we go negative, and that will be negative skewed curve. So in a box and whisker plot, if you found bar below, positive, bar in head, negative, okay? And I applied the same concept on positive likelihood and negative likelihood ratio also. Both formula is sensitivity by specificity. Sensitivity by specificity. But similarly, if the bar is below, it's positive. Bar below means 1 minus below. And if the bar is above, 1 minus above, it becomes negative likelihood ratio. So with that concept also, you can answer it and you cannot forget it. So these are the various questions which I guessed. I am 100% sure that the topics which we have covered, at least 20 questions will definitely come from these topics only, because we tried to cover almost all the topic. It was a long session, I know, but you were amazing in the reply. Thank you so much for being with me. And if there is any question you want to ask, feel free and put it in the group. There is a student whose name is Gobar Ajam. Gobar Ajam is saying, कि sir कैसे हो, giving NEET PG for the first time, and he is saying गजब comedy करते हो, मजा आ गया. Thank you so much, Gobar Ajam. You are actually good humorous person yourself, I think. And now we will meet and have some good time together. Anything you want to ask? Or sir, which PCR is better choice for unknown disease detection? RT-PCR or real time or multiplex or nested? Which PCR is better? Please help me find the better answer. RT-PCR is better or real time PCR is better? This is quite microbiological question, man. RT-PCR is reverse transcriptase polymerase chain reaction, and mostly RT-PCR is better, I think, but I am not confirmed, so I am letting this ball go. I don't know the exact answer, dear. I will search for it. Maybe I know, I will tell you. Okay. Chalo. And if you have any question, let me know. Okay. Ha, sir, please tell me, vitamin A first symptom, bite out spot or night blindness? My dear friend, with vitamin A, when patient come, he will complain about night blindness. So first symptom is always night blindness. But night blindness occurs so late that by this time retina has also dried, so we don't use this for screening. If night blindness is more than 1%, vitamin A deficiency is a public health problem. We will give vitamin A drop in the whole population. But the first sign with which patient you can detect in the patient is conjunctival girosis, dryness of conjunctiva. Okay. And the second sign is bite out spot. And I hope you know conjunctival girosis is sand on tide appearance. ऐसा लगता है जैसे सागर की लहरों पर रेत की परत हो. Why? because actually vitamin A deficiency lead to xerophthalmia, dry eye, and in xerophthalmia tear is less, so less tear is there, therefore dust particle will deposit in the eye. There will be some tear, some dust, some tear, some dust, so it will look like sand on tide. So that is the first sign, we call it X1A. Second sign is bitoid spot, X2B, X1B. But it's very difficult for a health worker to go and see dry eye, and she will have to look into the eye to find it. So which is used for screening? Bitoid spot, the second sign is used for screening. So do remember, first symptom is night blindness, screening by bitoid spot, first symptom is conjunctival xerosis, and if bitoid spot is more than 0.5%, again vitamin A deficiency is a public health problem. Okay, so do remember it and let me know if I can help you in any way. Okay, thank you so much. We will meet again. Till then, hasta la vista, dasvidania. Thank you for your rapid reply and your love. Thank you so much. Bye bye.